Good evening. Good evening. How you doing? Hello. Hello. She's becoming a little uncomfortable. Mm. Hello, welcome. Yeah, good evening. Good evening. Yeah, good evening. Welcome. Anyone you call is correct. Hey, Tima, good evening. Welcome. I'm waiting for us to get to 30 for me to start. We really need to go very fast today because I want to discuss at least the complete chapters. This camera has to follow me, right? Okay. I always said that. Huh? The thing is that left for me, I'll be very fast, but I need everybody to catch up most times. So if you guys answer very fast, right? I won't waste time. That's the truth. For example, we'll be 50 in a session, for example, and I'll put a question, and before 20 people will answer that question, it will take a long time. So it makes it a little slow. So I really want you guys, as many you guys have already studied very well for this class, when you come around like this, we'll be very, very fast. I don't have a time being fast. I don't have a problem being fast. All right. Okay, so let me start. I'll share my screen. Hold on, how many are we here? We are 28. Why? Where is everybody? We are supposed to be much more than this, guys. What's happening? Say, well, I am here. Okay, we are 30 now. We are supposed to be much more than this. I think next time we have to discuss. Next time we have to discuss to know when the majority of people will be available. You understand? So that we'll have everybody online before we start. Very, very important. So today we are taking chapter 14, 15, 16, and 17. Chapter 14 is talking about parenteral doses. It's at 30 currently. Oh, is it 30? Okay, no, we are up to 45 already. That's good. So today we are discussing parenteral medications. We are discussing IV medications. 45 now, yeah. We are discussing IV medications. We are discussing special populations, and we are discussing IV calculations. Extremely important. Please, anytime I'm lagging too much, I think once I share my screen, I always lag. All right, that's why I need to get a new laptop. Still thinking of which one to buy. Anyway, everybody's saying buy Mac, buy Mac, buy Mac. I'm so used to Samsung. So used to Samsung. But I hear that Samsung, this new Samsung, the screen is always breaking very fast. So still thinking. Anyway, So let's start. For this particular chapter, the outcome, listen, I'm not going to teach, all right? I just want to discuss very fast and we jump to the questions. The question is the main thing for me, not this. Anybody can actually get this slide and study, but the question is the main thing. So I'm just going to run through it very fast. Then we jump into the questions, all right? I hope all of you are active and engaged. These are the keywords. Medications like antiarrhythmic medications, the daily maintenance fluid needs, that's DMFN, dry weight, hemodynamics, heparin protocol, ideal body weight, that's IBW, loading dose, titration, and vasoactive medications. These are, the core concepts of what we are going to do today. All right. So we should know that it's very, very important for you to, calculate these doses, know what is required, especially for chronic illnesses or people that are critically, down. All right. And sometimes we titrate medications, all right, especially if those medications is going to affect the heart. You need to know what you are giving. You need to, do it in the way that's acceptable. And when you're talking about daily maintenance fluid needs, all right, children's bodies contain a higher percentage of water than adults. You should know that, all right. So when a child is critically ill, you need to know what to avoid, because if you just keep packing dosages into that baby, you can lead to fluid overload. Or sometimes you can give too much electrolytes and the child becomes have electrolyte imbalance. It can be too much, it can be too little. All right, and those things can affect hydration in terms of the baby, because children are very, very, their body is very special. Same thing with geriatrics. Sometimes you can see some of them vomiting, having diarrhea, fever. Do you understand? So all those things require that you calculate the DMFN. All right, that daily maintenance fluid needs of the child or of the patient. Now, this is the formula to calculate this daily maintenance need. Jesus, my leg is paining me. So these are the formulas to calculate the DMFN. All right, I need you to look at it right now. If it's not in your head yet, I need it to go into your head. All right, DMFN, extremely important. So for people that their weight, if the patient's weight is up to 10 kg, this is the formula we do the calculation: 100 ml over 1 kg times that 10 kg is equals to DMFL for that particular patient. All right. If the patient's weight is 10 to 20 kg, this is the formula you use. So it's left for you to know these formulas, because in your exam, nobody is going to give you these formulas. It has to come out from your head. Extremely important that you know this. And if the patient's weight is over 20 kg, you use this particular formula. So you need to remember it, because we're using it to calculate very soon. All right. Okay. So this is just an example. I'm not treating it right now. We'll discuss it later. Now, when you're talking about geriatrics, all right, dosages based on ideal weight. Geriatric patients, they have decreased body limb mass. Yeah, hello. They have decreased body limb mass. They have increased proportion of body fats. That's geriatrics, all right? So there are some drugs that are water soluble drugs, all right, which strongly bind to lean masses. So you need to also have this in your head as you give medication. Then we have fat soluble drugs. Remember here we mentioned what water soluble drugs. Why here we are talking about what fat soluble drugs. So you need to know which particular drug you are giving, so that you know how it will react on that particular patient. All right, extremely important. So all these things is just telling you about how you do the proper weight calculation. Okay. So this is the checklist. Check the package insert or product literature. Determine if the dose is safe based on renal function and ideal or actual body weight. Determine the dose based on the ideal weight. If the dose is safe, calculate the amount to administer. So what they are telling you is to check the particular dose, all right? Then calculate the ideal weight of that particular patient. The ideal weight, that's the actual weight. For example, if I get to the hospital now, my age, my height, you understand, there is a certain amount of medication to give me, maximum amount of medication to give me. So that's what you need to calculate. You don't give me medication based on, for example, if I'm supposed to give you medication for my age and my height, I'm supposed to give you medication based on a weight of 170 pounds, but I'm weighing 220 pounds. You don't give me medication based on the 220 pounds. That's what they're trying to tell you. Because if you give me medication based on the 220 pounds, it will become what? Overdose for me. So you are giving me medication based on my ideal weight. Ideal weight. That ideal weight may not be my weight, but for my age category, it is my ideal weight. It's as simple as that. All right. Okay. Like if you look at this question they give, they say a 78-year-old male, 5 foot tall, and weight is 180 pounds. Ideal weight range is 122 to 157. You see the point? So you are calculating with your ideal weight, not with this person's 180 pounds. So that's what you need to bear in mind. All right. We will discuss more examples like this. We will discuss the examples when we start answering questions. All right. Then another thing you need to know is hourly flow rates. That's another thing you need to know. Hourly flow rates. For hourly flow rates, you need to calculate the rate to administer a solution with medication using an electronic device in ml per hour. In ml per hour. You need to remember this. At the end of the day, you are still using the same formula we use. So if you don't know this formula yet, please go back to the other lives I did, all right, and look at this formula to how to get your D, Q, H, and A. All right, A is amount to administer. That's what they will ask you in the clinic. If you don't know this thing, if you're not strong on this particular thing, please go to the prior listing videos and look at it. Very, very important for you. All right. Okay. So for example, they look at this question. Find the hourly flow rate. The ordered is morphine sulfate 4 milligram per hour. On hand is morphine sulfate 10 milligram per 100 ml. Per 100 ml, right? DSW. What do? You need to get the entire thing, the parameters. You don't need to convert. All right? You don't need to convert because the ordered and the on hand is the same what? Is the same unit in milligram. So you don't need to convert. All right? So that's the thing. Then you follow your normal steps, your basic step, and get your A. Just put your formula. This formula we discussed initially using these parameters, the D, Q, H, and A. If you just put your formula, you get your answer. We've already done this thing in the other videos. So I'm not going through it now until we get to a question. All right? So I'm just showing you how the questions are. Another thing you need to know is about heparin. Extremely important. Heparin is an anticoagulant. All right? Preprinted order is order sets to guide administration of IV heparin based on weight. Serum activated partial thromboplastin time. All right? These are the two things that they base these drugs on. All right? Then there's something we call the loading dose, which is the initial dose given to achieve therapeutic blood level of heparin. That's the loading dose. You should always remember the loading dose. They won't ask you deep questions like this, but I'll give you an example of what they will ask. Look at this question. Calculate initial bolus dose of 80 units per kg. Maximum dose, 8,000 units. So they've given you the maximum dose. You can't exceed this dose. So if you get anything above this 8,000 units, it means that calculation is wrong. Or you need to check back to the person that made that prescription. All right? So what do? You do your conversion. We'll discuss a question based on this, all right? I'm not here to solve this right now. I'm just showing you an example. So we will discuss all these questions. Let me see. Okay, so another thing you need to also know is about adjustments, all right? IV flow rate adjustments. Goal of medication adjustments is to administer least amount of medication to achieve desired effect. Amount of medication needed varies. It varies based on a lot of things. So, but what do? The rule is that you need to calculate the weight based on intravenous rate adjustments. Determine the rate change needed using what? The current infusion rate. You need to know the current infusion rate. You need to know the protocol of the hospital. And also you need to know the patient's weight. These are the 3 things that you need to focus on. All right? Then after that, you start doing your subtractions, which we are going to do when we are solving a question. I'll show you how to do that calculation when we are solving a question. For example, they gave you this question, heparin infusion is at 25.5 ml per hour. That the equivalent is 18 units, all right? And the patient weighs 70 kg. The APTT result is 120 seconds. What is adjusted flow rate? This is the way the question comes. So I'll give you a question like this, then we'll solve the main thing, all right? It's currently at 30. I'll give you a question like that. I don't want to solve these examples so that we don't waste time on it, but we'll solve the real questions, after this. Okay. me see. So after that, you check if it's reasonable. That was what I was talking initially. Somebody say shish. Okay. Then for safe titration, all these things are important for safe titration. You should calculate the starting flow, calculate the minimum allowable flow, calculate the maximum allowable flow, begin infusion at the starting flow. So meaning that you need to know when to start, know the amount to give, all right, and know the maximum you cannot give, all right. Extremely important. Then you titrate your stuff. Do not exceed the maximum rate. It's as simple as that. Okay. This is a very long question. They hardly give you this kind of long questions in exam. All right, but even if they give you this long question, you should be able to just bring out the parameters. The most important thing is what? Bring out the parameters and start converting. Check it out. Bring out your parameters and do what? Start converting. Okay, so like this question now, you have to convert from mg, milligram to what? mcg. All right, milligram to mcg. 1000 mcg is 1 milligram. So if you just do cross multiplication, you get your x. It's as simple as that. All right. Okay. So automatically 400 milligram becomes the x becomes 400,000 milligram. All right. So when you do your calculation, you get the most important thing. Okay, hold on. Okay, summary. So this is just what this chapter is about. All right. This chapter is just about, how you get your normal calculations. Somebody's raising up hand. Yeah, it's okay. You can always ask any question, but I want to take questions when we start solving the main thing. I'm just giving you a rough sketch of the entire thing. The learning outcome is to calculate the daily maintenance dose. That's 1. To calculate doses based on weight and renal function. That's 2. To calculate the hourly rate. That's 3. To calculate IV heparin dosages. 4. To calculate the IV flow. To calculate the IV rates and the titration medications. All right. These are the things you need to know. You understand from this chapter. In this chapter 17. Why did I start with chapter 17? Terrible me. So I'm supposed to start with chapter 14 and I started with chapter 17. Jesus Christ. No wonder. I was wondering, why am I doing IV already when I've not done parenteral? So, but fine. Since we've already done it, I'm not going to do chapter 17 anymore. I'll just solve the questions. All right. So I want to jump to chapter 14 now. Yeah, it's fine. I want to jump to chapter 14 now. All right. It's just parenteral. It's straightforward. Straightforward. What you need to know is about calculating the actual doses, all right, of parenteral medications. You need to know the duration, high alert medication, insulin, outset, peak, and solutions. Suspension, U100, U500. This U500 is very, very important because that's what they usually ask you. I will show you a question based on that, all right? Okay. Now you need to know these things. IV, 30 to 60 seconds. IM, 10 minutes or more. All right, it's talking about absorption rates. Absorption is the amount of time it takes to enter the bloodstream. The SubQ takes 15 minutes. ID is sustained. All right, so IV is 30 to 60 seconds. Immediately you're injecting the patient, you are injecting directly into the vein. All right, now this is injections. Then we need to know the dosage or solution strength. That's the amount of drug contained within a volume of solution. That's what we mean by dosage strength. They will ask you, but we've already done these things, so I don't want to waste time on it. Dosage strength is expressed in milligrams per milliliter, all right? Milligram per milliliter. Now, sometimes it's expressed as a percent and as a ratio. As a percent and as a ratio. So they may ask you, what are the ways dosage strength can be expressed? One is as a milligram per milliliter. Another one is as percent. Another one is as ratio. Now, if they give you that dosage as percent, how do you calculate it? That's the question. For example, they tell you 1% lidocaine. That 1% lidocaine means 1 gram lidocaine in 100 mils. If they tell you 10% lidocaine, it means 10 gram lidocaine in 100 what? Mils. Check it out. No stress. Now, when they are talking about as a ratio, all right, anything in the beginning, that's like, for example, you see 1 ratio, 1,000. Anything in the beginning is the gram. Anything at the ending is the mil. Check it out. No stress. So if they give you 100 ratio 5,000, for example, what does it mean? It means what? 100 grams of that medication in what? 5,000 mils. It's as simple as that. I believe all of you understand what I'm saying. Okay. So when they ask you to calculate parenteral dose, just follow our normal stuff. Just as I discussed in the IV, for parenteral, still the same thing. Follow the normal pattern. Gather your information. Write out your information. If conversion is necessary, you convert. Remember when conversion is necessary, all right, based on the other dose and what dose at hand. If they are in different words, the other dose and dose at hand is in different units, that means conversion is necessary. If it's in the same unit, that means conversion is what? Not necessary. All right. I believe these are not new facts for you anymore. So that's why I'm going this fast. Sorry if I'm too fast. Then after that, you do your calculation. I always prefer formula method. Everybody knows I prefer formula method. But anyone you prefer, that's for you. But you need to what? Perfect one method. You need to perfect one method. All right. Now, when you're talking about syringe sizes, all right, you need to know your syringe size because they will ask you a lot of questions on syringe sizes. A lot of questions. If the amount of injection to administer is 1 ml or more, what do? Round the amount to tenths and use a standard 3 ml syringe. That's number 1 rule. Number 2 rule, if the amount of injection to administer is less than 1 ml, but greater than what? 0.5. Mind you, less than 1, greater than 0.5. Calculate evenly to the tenths and use what? 1 ml tuberculin syringe or what? A standard 3 ml syringe. So your first option is 1 ml syringe. Your second option is a standard 3 ml syringe. If the amount of injection to administer is less than 1 ml, yes, tuberculin syringe. If the amount of injection to administer is less than 1 ml, round the hundreds and use a 1 ml tuberculin syringe. For amounts less than 0.5 ml, use what? A 0.5 ml tuberculin syringe. You understand? They will give you questions, they will give you, diagrams, of this syringe and give you an ordered dose. You should be able to tell them, this is the syringe I'm going to use. Very, very important. But where they always catch you, where they will choke you, is usually when you are talking about what? Insulin syringes. And I'll show you, all right? For example, they tell you amount to administer is calculated at 0.6 ml. Which syringe would you use? 0.6 ml. Which syringe would you use? You understand? You look at the diagram here. For 0.6 ml, you can use either what? 1 ml or 3 ml. So if they give you that option, if they give you 1 ml and 3 ml, please choose 1 ml. But usually they will not put that 1 ml and 3 ml in that particular option. That's just the truth, to avoid confusing you. But you should use that. You should know that as far as it's more than 0.5, you can use either 1 ml or 3 ml syringe. Very, very important. Okay. Where am I? Okay. Now, correctly round the amount of injection to administer, round volumes greater than 1 ml to the nearest tens, round volumes less than 1 ml to the nearest 100. Just remember these rules, all right? Amount to be administered is calculated to be 1.66 ml. The volume is greater than what? 1 ml. So round it up to what? Nearest tenth. Becomes what? 1.7 ml. I hope you understand what we just said now. Round volumes greater than 1 ml to nearest tenth. But if they are less than 1 ml, round them to what? Nearest hundredth. This is the formula you cannot forget. Please. All right? Okay. Look at this one now. You see, amount to administer is calculated 0.532 ml. The volume is less than 1 ml. So what do? You round it up to the nearest what? Hundredths. That's why it becomes what? 0.53. Okay. Now, you see this particular formula is also very important. What you can know is sit in one site. If you are giving an IM injection, intramuscular injection, for adults, you can know it's 3 ml in one particular site. If you are supposed to inject that adult a 5 ml, inject 3 ml and 2 ml in another place. That's what they're telling you. You have to divide it. You have to remember this thing. All right? Now, if it is in the arm, in the deltoid, for example, all right, you want to inject that patient IM in the deltoid. As far as it's in the deltoid and an adult, you cannot exceed 1 ml. So if you want to inject 2 ml, what do? Give one here and give one here. Don't exceed 1 ml. That's standard. All right? IM, mind you. Now, for a child 6 to 12 years, you cannot exceed 2 ml at a site. For a child 0.5, for a child 0 to 5 years, you cannot exceed 1 ml. So if you go to the hospital and they want to give your baby more than 1 ml in one place, refuse. Tell them that that's the wrong teaching. All right? If it's a premature infant, you cannot give what? more than 0.5 mil in one place. If it's a subacute, general 1 mil, you cannot exceed 1 mil as a subacute. Remember, all these things we discussed is what IM. See how I took my time to discuss it now? Okay. So when you do the calculation, write out your stuffs. Know if conversion is necessary. You see exactly what we did in IV. So it's the same thing. Once you know this calculation, you know this calculation. If you are finding it still difficult to calculate, go to the prior videos and look at it. All right. And please, when you go to those prior videos, anytime you watch a video, at the end of the day, I want you to make a comment, write ready at the comments. All right. Don't forget, write ready. And also, if you've not clicked this thing, look at your screen. You see that thing that looks like this? Click it. Okay. So these are these different methods. We've already discussed these things. Okay, now, when a solution strength is expressed as a percent or ratio, what do? Convert the percent or ratio to what? Dosage strength. Such as what? G per mil or mg per mil or units per mil. Calculate the amount to administer, then apply the rules that we've discussed already. If it is in percent or ratio, you must convert it to G per mil, mg per mil, or units per mil before you calculate. If you don't convert it, you cannot do the calculation direct. If you do the calculation direct, you get a wrong answer. Okay. I hope you remember that formula. Very, very important. All right. Let me see if I'll see a question. 3 mil, blah, blah, blah. Okay. No. So this is a practice question, but we'll do our own practice properly. Yeah. So when you are preparing parenteral medications for administration, all right, medications that lose potency quickly in solution are supplied in powder form. So when they give you any medication in powder form, just know that it loses potency quickly. So whenever you reconstitute it, right, by applying a diluent, you need to be able to what? You need to write when you reconstituted it, so that you don't go and give medication that has lost potency. All right. So first of all, what you need to do is to determine the fluid to use. They will ask you this question in the exam: which particular fluid do you use? Sterile water, saline, bacteriostatic what? Solution. Sometimes in the package, they will tell you the appropriate solvents to use. Very, very important that you know that. So you need to always read that packet. All right? You need to always read that packet. Some medications are mixed with lidocaine, especially if those medications are very painful medications, like ceftriaxone. They can give you a lidocaine bottle in it, or injection water. You understand? So it depends on which particular technique you are using and what you want to use exactly. So to reconstitute a powdered medication, find the directions. Very important. Use sterile syringe and aseptic technique to do what? To drop the diluent. Sterile syringe, aseptic what? Technique. Sterile syringe, aseptic what? Technique. Then after that, inject the diluent into the medication vial. Agitate the mixture by, you can either shake it or you turn it upside down. Do it like this. Very, very, very important to remember to do that in the clinic. Make sure the powdered medication is completely what? Dissolved. Make sure it is completely dissolved. How do you make sure of this? Look at it very well. If you see any visible particles, continue shaking. All right? Continue shaking. In the clinic, if you want to inject and there is a particle inside it, they will ask you, who taught you? Please don't call my name. You understand? Because what I'm teaching you now is that you have to shake it until there is no what? Visible particle in it. All right? So you now use the specified amount of diluent. Don't use too much and don't use too little. Very, very important that you know that. And when you store a medication after reconstitution, record these things. They will ask you, one of the following should not be recorded. It's not necessary to be recorded. So you need to know these things that should be recorded, which is date time of reconstitution, date time of expiration, your name or initials, and other solutions. All right? So you see the packet, you see the informations you need to use, see the storage here. All right? For IV use only. This is the storage. Then they give you the strength and how to reconstitute. They're telling you what to reconstitute with here. So you need to always read that word insert. They will give you questions, like this, and you look for how to reconstitute it actually. Okay. Let me see. So other parenteral administration forms, like inhalants, and others, suppositories, transdermal medications, all these things, they give the information on the pack. So the most important thing I want to discuss with you is insulin. All right, insulin are high alert medications, high alert. So we have insulin and we have heparin. The two of them are high alert medications. Very, very important that you know that. Talking about insulin, we know that insulin is produced by the beta cells of what? Pancreas, the beta cells of pancreas. What does insulin do? Insulin, is a phase messenger. You will learn this thing in our AP. Insulin is a phase messenger. It laps on insulin receptors in the plasma membrane of the cell and triggers intracellular activities, which leads to what? Conversion of sugar, that's glucose, to what? Glycogen, which is the storage form of glucose in the body. Why? Because normal glucose is what? Toxic to the body. So that's what insulin does. It's a pancreatic hormone, they will ask you. Sometimes some people have low production of insulin or no insulin production. That's people we call what? Insulin-dependent diabetes. All right? Insulin-dependent, that usually happens to younger people. That's type 1 diabetes. Now, there are some people, they have insulin production normal, but the problem is the receptors. That's type 2 diabetes. Usually happen to more elderly people. That's type 2 diabetes. All right? Okay. So there are types of insulin. We have genetically engineered insulin. We have human insulin. We have synthetic insulin. But what is important is this information, because that's what they will ask you. What is the meaning of onset? What's the meaning of peak? What's the meaning of duration? Onset, when insulin begins to act. Peak, time when insulin's effect is at its highest. Duration, the amount it takes insulin to act. Check it out. Now we have timing of action. We have rapid acting, short acting, intermediate acting. You need to know which one is which. Rapid acting, quick onset, short duration. Quick onset, what? Short duration. 2 minutes. Don't mind me. All right, 15 minutes. Must be administered within 15 minutes of meal because it acts very fast. Then we have what? Shorter acting, which we call regular. That's R. Shorter acting. This shorter acting, they start slowly, but they last over a long period of time. So because of that, what do? Give them before meals. 30 to 60 minutes before meals. Rapid acting within meals, 15 minutes within meals. Shorter acting, 30 to 60 minutes what? Before meals. You should always remember this. Insulin is high alert medication. So it's also very important that you know that. R is regular, intermediate is N, slower onset, longer duration. All right? Mixed, both acting, intermediate. They are mixed. You have both acting and what? Intermediate. All right? I'll show you this. So this is the onset, the peak, and duration for each and every one of them. I believe that by now you know this because they will ask you a question on it. All right. We have insulin that is U100. Usually the regular ones, they are usually what? U100. U100 means what? 100 units per mil. All right. 100. So if each unit of that particular insulin is what? 100 what? Units. All right. So you look at this thing now. Each meal is 100 units, meaning that what? This is 10 meals. So there will be what? 100 times what? 10 in this particular entire medication. That's what they're just trying to tell you. So here now you have like 1,000 units. It's as simple as that. Okay. We'll discuss it more later. All right. So this is expiration, brand name, concentration, storage information, manufacturer's listing, name, the origin, that's human insulin, type, regular, U100, that's concentration, and everything. Every information is on the label. Insulin is high alert, so they don't joke with it. Every information is on the label. But another thing you need to know is the syringes to use. All right, these syringes are marked. We have 100 capacity syringe, 100 units capacity, 50 units capacity, 30 units capacity. 100 units capacity, 50 units capacity, 30 units capacity. All right, they are calibrated in incremental form. Very, very important for you to know. Now, this is your question. 50 units capacity insulin for insulin doses less than what? 50 units. 30 units capacity insulin for insulin doses less than what? 30 units. Chicken. All right. Ordered Humulin N66 units. So this is 66. What do you use? 100 units capacity. Simple. This is a Humulin R regular 8 units. What do you use? 30 units capacity. But bear in mind, all right, all this thing is U100. and below. When it is U500, the equation changes. I'll show you. All right. So now we are talking about U500 insulin. This is U500 insulin. How do you get the exact? Stuff? Now, if they give you, if the order is U500 insulin, what do? You cannot use those other syringes that we've mentioned. Instead, you use 1 ml tuberculin syringe. That's what they're trying to tell you. So what do? You just convert this U500 to what? Ml. It's as simple as that. So you calculate the amount to be administered in milliliters. That is when you are talking about U500. You will see a question. Don't worry. I'm not stressing on this because you will see a question on it. For example, look at this. They say determine the amount of insulin to give. They gave you humulin R, that's a regular humulin, U500 insulin. U500 insulin, and they gave you the units, 120 what? Units. 120 what? Units. So what do? How do you calculate this thing? All right. So what you need to do is to convert units to mil. Units to mil. So you ask yourself, 500 units is equivalent to how many mils? 1 mil. 500 units, 1 mil. All right. And here they gave you 120 units. So what do? You convert this 120 units to mil. And when you convert 120 units to mil, you get what? 0.24 mil. Some people, it may be a little weird to you, but what you need to do, immediately you see this kind of question, this is U500. Oh, they are talking about U500. So they will give you units. How many units do they want you to give? 120 units. Okay, since they want me to give 120 units, I know that every 500 units is equivalent to what? 1 mil. 500 units, 1 mil. So if 500 units is equals to 1 mil, 120 units is equals to what? X. And when you cross multiply, you get 1 mil times 120 over 500, and your answer will be 0.24. Don't worry yourself. I'll give you a question and we'll do the calculation. I will do the calculation for you on screen. All right. So, but what I just need you to know is that immediately you see U500, know that you don't pick the same thing as we were picking in maybe U100 or U50 or U60. All right. So bear that in mind. I'll get back to it. All right. Okay. Now, this is technique to inject. I'm not going to discuss much on this. This is technique to inject. How do you inject insulin? This is it. All right. So take your time and read this thing. I'm not going to talk about it because we are almost 37 minutes. 37 minutes. Wow. So this is how you prepare, how you inject, the insulin. Okay. How you draw. This is how you draw. This is diagrams, how you draw, which one you draw first and which one you draw second. All right. I'll ask you a question on it. This is insulin combination. All right. Short-acting insulin plus intermediate insulin. 10 units, 42 units. Everything will give you the total, which is 52 units. So this is practice. Now, heparin. Let's talk about heparin. Heparin is an anticoagulant. All right. Heparin is an anticoagulant. What does it do? It decreases the ability to form what? Clots. And we administer it in USP. They will ask you these questions. All right. Sometimes heparin, we have something we call a heparin log flush. All right. We use it to do flushing. We have something we call heparin for SubQ or IV doses. All right. But you need to calculate properly. And they will write it on the body. Look at it. They will write it very, very well. Example, we have 1,000 units SubQ. We have 2,000 units IV. We have 7,500 units SubQ. You will see it on the label. So you don't need to stress yourself on this. You will see it on the label. So what you need to do is to check the dosage strength. Extremely important. After that, when you check the dosage strength, gather your formula, gather your ABCs, all right? And do your thing. Look at the equation. For example, they say find the amount administered. Other dose heparin, 2,500 units SubQ. On hand heparin, 5,000 ISP. All right? You don't need to convert because all of them are units. So what do? You bring out your information like this, use your formula method, and you get your A. Check it out, and you move. All right? Okay, that's exactly what we did here. Just get your formula, and get your A. A is amount to administer. Okay? What else? Okay, that's it. Yes, that is it. So I'm going to give you a question on parenteral right now. After that, we do chapter 15, chapter 16. For chapter 17, I've already explained it, so I'm not going to explain it again. I'll just go straight to the question. All right? Okay. So guys, you know the formula. Hold on. You know the technique. And the technique is that everybody must give me an answer. If not, I will not move. Chapter, hold on. Chapter 14. So everybody has to give me an answer. Okay. I want us to be as fast as possible, guys. Because I've not eaten. Okay. So I'm going to stop now. Are you ready? The formula is that everybody must respond. If you have a problem, just write 911. Are we here? Can you even hear me? Are you sure you can hear me? Somebody said no. So the formula is that you write 911 if you are not sure of your answer. But I really want you to solve. Don't follow the crowd. If everybody's writing 45, don't follow them to write 45 when you got 30. Write your 30 with all your heart. All right? You don't need to be ashamed of anything. If you are learning calculation, drug dosages, you need to be shameless. All right? And mind you, I didn't solve most of those stuffs because we've already done it in all the lives before. So instead of wasting time doing it here, you should go back. If you're having a problem with calculation of administration of those, go back and look at it. Right now, I'm jumping into parenteral. I'm going to ask you 30 questions from parenteral, and we'll be very fast. All right? Okay. So I'll be expecting 20 people to give me an answer for me to move. And I'll be fast, honestly. So look at this question. Which syringe would be used to administer 0.9 ml? Which syringe would be used to administer 0.9 ml? Options: insulin syringe, 1 ml tuberculin syringe, 3 ml standard syringe, large capacity syringe. Insulin syringe, 1 ml tuberculin syringe, 3 ml standard syringe, large capacity syringe. We are testing the microphone. Hello, hello. This is my mic. Time for you to shine, everybody. What is happening? Are you guys sleeping? Are you guys sleeping? Wake up, wake up, wake up, wake up. We need to be fast, all right? If I don't get 50, I won't move and it will waste our time. So I need everybody, if you are not sure, write not sure. You need to write something. Which syringe will be used to administer 0.9 ml? Okay, yes, 1 ml. Okay. Please, we need to be very fast. These ones are just little questions so that we'll be able to go to the main thing, all right? Quickly. I need us to finish in 2 hours at most. Okay. Yes, the answer is 1 ml. Which syringe should be used to administer a 0.6 ml IM? IM. Option A, 1 ml tuberculin syringe. B, 3 ml standard syringe. C, insulin syringe. D, 5 ml syringe. Which syringe should be used to administer 0.6 ml IM? Which syringe should be used to administer 0.6 ml IM? 1 ml tuberculin syringe, 3 ml standard syringe, insulin syringe, 5 ml syringe. We are just testing the microphone. No? Come on, guys. Come on, guys. We're up to 40 here. This is testing the microphone. This is where you should be shining before we get to the main thing. This is where you should shine. Eh? It's your time to shine, guys. Before we get to the main thing, if you are not shining now, where will you now shine? So for 0.6 mil, 0.6 mil IM, it is 1 mil tuberculin syringe. Please remember that. Extremely important that you remember that. All right. My system is lagging. Like I need to get a new laptop ASAP. This Black Friday, I don't know if it's actually working. Maybe I can check if it's working and know if I can get something subsidized. Yes, because it's 0.6 exactly. Look at this question. Which one of the following route is it routes or routes? I don't know. Which of the following routes of administration is not an injectable? Which one of the following routes of administration is not an injectable? A. Sublingual. B. Intravenous. C. Intramuscular. D. Subcutaneous. Sublingual, intravenous, intramuscular, and subcutaneous. Which one of the following routes of administration is not an injectable? Quickly, guys. Sublingual, intravenous, intramuscular, subcutaneous. Yes, the answer is A, sublingual. You guys are so hot this night, though. Okay. Let's start approaching the... We are still testing the microphone, mind you. Yes, the answer is A. You're correct. The answer is A. Look at this question. By your calculations, you should administer 2.46 ml. What amount will you draw up in the syringe? By your calculation, you should administer 2.46 ml. What amount will you draw up in the syringe? Oh, you say options. I should not be giving you options, though. This is testing the microphone. Okay, I'll give you option. 2.46 mil, 2.4 mil, 2.5 mil, 2 mil. 2 mils. Has to be S, right? Plural. 2.46 mil, 2.4 mil, 2.5 mil, 2 mil. Yes, the answer is 2.5 mil. You have to round it up based on the rule. Yeah. Round to the nearest tenth. Yes, because it's above 1. All right. So the answer is 2.5, not 3. Oh. Somebody said 3, not 3. You have to round up because it's more than 1 mil. It's rounded to the nearest tenth. Okay. That's good exercise. We are still testing the microphone. The truth of the matter is that these questions are not that difficult if you understand everything I discussed. All right. Or if you've read it before, these questions are not that difficult. The even copy on this my laptop is now annoying me. It's becoming annoying. Okay. When storing a medication after it has been reconstituted, all of the following should be recorded on the label, except, I'll give you options. When storing a medication after it has been reconstituted, all of the following should be recorded on the label, except A, the date, B, the time of expiration, C, your name or initials, and D, solvent used. Which one is not written on the label after you reconstitute the medication? I'll give the options again. The date, B, the time of expiration, C, your name on initials or initials, D, solvents used. Yes, the answer is D. You guys are really engaged. I like it. If you can answer like this, then we'll move very fast. The answer is D. It shows me that majority of the people know what they are doing. All right. The answer is D. Solvent used. When you reconstitute a drug, oh, I have a powder drug. I mix it with this water. I inject 1 ml, and it's still remaining like 3 mils here. So maybe tomorrow I have to inject another one. But that tomorrow I may not be on duty. Another nurse or another doctor will be on duty. What do? I have to write even if I am the one that will be on duty, you have to write the date, the time of this thing expiring, and also my initials, and sign it. Very important. But I don't need to start writing, oh, I use the lidocaine. No, it's not necessary, because we're expected to use the solvents that's written on the medication. Okay. So look at this question. I'll put all the options. All right. So you just give me a minute. Let me put in the options for you. Okay. This is A. And this is B. The answer is you don't need to write solvents. The answer is D. All right. You're talking about the last questions, correct? Yes, the answer is D. You don't need to write solvent. You need to write your name. You need to write time. You need to now write expiration. You understand? You need to write, what did I even mention that time? I said you need to write the date, the time of expiration, and also your name and initials. But you don't need to write solvents used. So guys, look at this question. When administering a 5 ml dose for injection, you should divide it by drawing upwards. Those are the options. A, 2 ml in one and 2 ml in another syringe. B, 2.5 ml in each syringe. C, 1.5 ml in one and 3.5 ml in another. D, 4 ml in one and 1 ml in the other. You say B, but it doesn't specify IM. Is that the rule only for IM? Yeah, so the thing is that if it's IVs, it's actually different, right? So, but here, if you look at the options, right, they are not telling you that you must give the 5. So you are assuming that, okay, you have to divide this dose. That's why they said divided dose. So whenever they are talking about divided dose, you should always try to make it very equal to each other, all right? Especially something that doesn't exceed 3. It's as simple as that. Okay? Yes, you guys are so correct. The answer is B, 2.5 ml on each, so that they don't exceed 3. So here we are assuming that they're talking about what? Intramuscular. Very important. Okay, yeah. So look at this. A medication with a strength of 25% contains what? Do I need to give an option on this one? Okay, fine. Let me give you options. This is A. Somebody is already proactive. This is B. This is C. And this is D. So a medication with a solution strength of 25% contains A, 25 grams of medication per 1000 ml solution. B, 25 grams of medication per 10 ml solution. C, 25 grams of medication per 100 ml solution. D, 1 gram of medication per 25 ml solution. Okay, this is interesting. What happened? Is it becoming difficult, guys? Keep going, guys. A medication with a solution strength of 25% is what? Okay, guys, all of you did well, all right? But if you pick C, you are correct. 25% means 25 grams of that medication per 100 ml. Please remember that. 25%. You say I changed my mind. Okay. 25% is 25 grams of that medication per 100 ml solution. No, it's good that you even if as you wrote it, maybe you failed it right now, but at least you remember it. All right, you remember it. So just try to remember it. All right. All right. Let me give you. Somebody's asking about ratio. Don't worry, I'll give you a question on ratio so that you consolidate what you know. Look at this question. The dosage strength of a solution. You're asking me about ratio? Are you asking me about ratio? You say what's one in 1,000 is 1 gram in 1,000 mils now. That's what it means. That one is ratio. Don't worry, we'll discuss a ratio. It's okay, I understand. We'll discuss ratio. So look, guys, the dosage strength of a solution with a strength of 50% is what? You say, what is the answer? Are you asking the answer for the other one that we just passed? For the other one we passed is 25 grams of medication per 100 ml solution. Whenever you see 25%, it means 25 grams of that medication in 100 ml solution. All right. Now I gave you another question. The dosage strength of a solution with a strength of 50% is what? What is 50%? Guys, quickly. Quickly, everybody. I don't need to give option in this one now. It's almost the same thing with the last one we did. So if you understand that last one we did, you should understand this one. The other one talks. The other one I said 25%. This one I say 50%. It's the same thing. It's just the difference in percentage. So that's why I'm not giving option. Come on, guys. Yes, this 50% means 50 grams exactly. 50 grams of medication per 100 ml. Percentage is over 100, so per 100 ml. All right. Now let's talk about the one somebody was asking me about. Look at this one, and you can relax. I'll put the options in the box. Look at the question, then look at the options. Don't worry, I'll give you the options, guys. This is incoming, guys. Incoming missile. This is A. Seems so slow for me. This is B. This is C. And this is D. What's the answer, guys? Is a 1:500 solutions has a dosage strength of what? A, 1 gram of medication per 1,000 ml solution. B, 5 gram of medication per 100 ml solution. C, 500 gram of medication per 1 liter solution. D, 1 gram of medication per 500 ml solution. What's the answer, guys? Okay, everybody's picking D. Me, I pick D with you guys, so not C, guys. The answer is D. Like I remember somebody asked me 1:1,000. I told the person that it's 1 gram of medication per 1,000 ml. So the first thing before the ratio is what? Gram. The next thing after the ratio is what? Is what? Mil. So 1:500 is what? 1 gram of medication per 500 mils. All right. So the answer is D. Guys, the answer is D. Crystal clear now. Okay, so we are done with that part. We are done with that part. I know somebody who is like, oh, thank God. Oh, Lord, thank you. Okay. Which of the following is not a solvent used to reconstitute powdered medication for injection? Which one is not? Always remember, this not is something that fails a lot of students. All right. The options, let me give you the options. A, sterile water. B, sterile saline. D, tap water. Sorry, C, tap water. Then D, bacteriostatic solution. Sterile water, sterile saline, tap water, bacteriostatic solution. Okay, it's tap water. Everybody seems to get this one correct. How can they even ask that kind of question for college students that are nursing college students? No, now. I think that question is too easy. Look at this particular question. When a suspension is reconstituted, the particles look at the options. A. I'll catch some people now with these options. B. C. Somebody's wondering, what the hell is this? What's this guy writing? D. Okay, talk to me, people. When a suspension is reconstituted, I need you to look at the question very well so that they don't catch you off guard. When a suspension is reconstituted, the particles A do not dissolve completely. B are distributed evenly without shaking the container. Dissolve completely if the container is what's shaking. Dissolve in warm water. Come on, guys. I need everybody to contribute. This is not solving, so you are not running away. You understand? Okay, so some people choose A, some people choose C. When a suspension, did you hear the word suspension? Suspension means that naturally that drug will be suspended, no matter what you do. It's as simple as that. All right. So the answer is A. Do not dissolve completely. Suspensions cannot dissolve completely. That's why they are called suspensions. I know that I'll catch some people, and I did. Please, the answer is A. Do not dissolve completely. He said, I will say C, but I'm not sure. No, it's not C. If you check, look at the other options. Now, all of them are the same thing. Dissolve in warm water here. Yes. Dissolve completely if the container is shaking. Yes. Are distributed evenly. Look at B and C is even the same thing. Distributed evenly without shaking the container. Dissolve completely if the container is shaking. The two of them are the same thing. I say, whoop, whoop. I caught you. Okay, please, the answer is A. Suspensions do not dissolve completely, guys. Look at this. After a multiple dose vial is reconstituted, you must write the dash on the label. A, dose ordered. B, desired dose. C, amount to administer. D, solution strength. What's the answer, guys? Somebody said the options again. After a multiple dose vial is reconstituted, you must write the dash on the label. A, dose ordered. B, desired dose. C, amount to administer. D, the solution strength. What was the answer? So the answer is D, solution strength. Why? Because the solution strength should be written on the label of a multiple dose vial, at the time it's constituted. So why are you writing it? All right. So the answer is solution strength, guys. Solution strength. See, am I sleeping? No, I'm not sleeping. No, I'm not. Look at this question, guys. Everybody, please. I'm not sleeping. No, I'm not going to be writing down the answer. It will slow me down. That answer is very straightforward. Other one is testing the microphone. There are some questions I will solve, all right? Not for this chapter. When we go to the more serious chapters. You understand? So I'm trying to speed up. As you see me, I'm trying to get some questions. That's what I was trying to do. The particular questions I need for you guys to understand. All right? It's when you write. So don't worry, there's time where I will start writing down, but I need you to follow me, all right, as we are proceeding. Why are we 45 and this thing is only 8? This thing should be 45 like you. Okay. What is the answer to this question? The amount to administer is dash. Other dose on hand is this. What's the amount to administer? If you're finding it difficult to calculate, just use the formula. Your administration is A is equals to, let me see, A is equals to D. A is equals to D over H times Q. A is equals to D over H times Q. That's the formula. A is equals to D over H times Q. So what is your A? From what you are given, your D is what? 0.5, 0.5, right? Yeah, 0.5 mg. You write it up over your H, which is 1 milligram. Milligram cancels milligram times 1. So 0.5 over 1 times 1 mil. So it's 0.5 times 1 mil, which is what? 0.5 mils. Any question? If you are confused, right? Can we use the order? The order what? Formulas? Of course, you can use the proportion method. You can use the other method. There are 3 methods you can use. But for me, I always like using the formula method because it's very direct and straightforward. Yeah, of course, this H over Q is equal to D over A. If you cross multiply, make A subject of formula, what will it give you? If you make A subject of formula, you understand, you will get your answer now. It's very straightforward. Yes, just make a subject every time you are doing this thing. Make a subject of formula, or make what they are asking. If you just know the formula, make what they are asking you the subject of formula, and you get your answer. Check it out. Yeah. Okay. So using that formula, I want you to calculate this for me. Using that formula, yes, the answer to that question is 0.5 mils. All right. But I need you to calculate this one. Calculate the amount to administer. Ordered chloroquine hydrochloride 300 mg IM daily. On hand chloroquine hydrochloride 200 mg per mil. Right? So what is A? Guys, what is A? Quickly, quickly, quickly. This one now should not be taking you time at all. One 1.5 mils. Okay, so that means I don't need to solve this. The answer is 1.5 mils. Just put your H is equals to 200 milligram, Q is equals to 1 mil, D is equals to 300. Use your A. You understand? Use your A. A is equals to what? A is equals to D over H times Q. Chicken out. So 300 milligram over 200 milligram times 1 mil will give you the answer. I don't know what it is, but it will definitely give you 1.5. All right. So that's how to do the calculation. I need you to master this calculation. Master it. Okay, so I have to bring my Word. Hold on, let me put up Word. I need to share Word so that I can put this question for you guys. See how slow this thing is. I really have to get a new laptop. If not, it will be difficult for me to do anything. Just give me a minute. Still trying to navigate my stuff. Okay. So I want to share my screen. Mm-hmm. I believe you guys can see my screen now. Okay. So that's the level, the medication level. Let me give you the question. Look at the question, guys. What's the answer? Also holding us. I already got 2 questions now that I forwarded now that I'm going to ask you. So you need to hurry up, guys. There are 10 more questions I'm trying to fix up, not one. Okay. Some people are still solving. I'm giving you 5 seconds, please. 1, 2, 3, 4, 5. So the H is 40 mcg. The Q is 1 mil. The D is 12.5 mcg. Using your A, the formula is D over H times Q, which is 12.5 mcg over 40 mcg. Mcg cancel each other, times 1. 12.5 divided by 40 should give you, hold on, let me do it. Should give you 0.3125 multiply times 1. So everything is 0.3125. You round it up to 0.31 mil. Okay. So you finally feel comfortable pulling numbers. Exactly. So it's very, very straightforward. So what do we get? We got 0.31 mil. All right. Amounts less than 1 mil are rounded to the nearest 100. And 0.3125 is less than 1 mil. So you round it to the nearest 100, which is 0.31. All right. So the other dose is a little less than a third of the dose on hand. So the answer is very reasonable. So that's why we have 0.31 mil. Straightforward. So even if they give you a diagram, like an image of the label, you should not get worried because this is what you see in the clinic. This is what you keep seeing in the clinic. All right. So it shouldn't worry you. Now look at this one. Look at this one. This thing is a little small. Let me make it bigger. Is it better? This is the main thing you need. Okay, look at the question. Calculate the amount to administer. Yes, you have to keep the one now. Nearest 100 is 0.31 mil. Do you understand? 0.31 mil is the nearest 100. Okay, look at this one. Calculate the amount to administer. Other doses of filgrastim is 120 mcg, SubQ daily. All right. So what's the amount to administer? Quickly, guys. Quickly, guys. Keep going, guys. You have trouble with the level? Why? Can't you see the label very well? Well, you just pick what you need. Remember, what do you need? You need H, you need Q, you need D, right? They've already given you, let me see, people are getting 0.25, some people 0.4, some people 0.3. Okay, so they've already given you the other dose, all right? So your other dose is the same thing as your desired dose, because if you look at the label, that filgrastim is in mcg, so your other dose and your desired dose is the same thing. So meaning that your D is 120, right? Look for the quantity. What is the quantity? 1. Look for the dose at hand, all right? What is your dose at hand? Your dose at hand is 300 mcg. Look at it. If you look at the label, you see the dose at hand. They say 300 mcg is how many ml? 1 ml. So quantity 1, dose at hand is what? 300 mcg. And desired dose is 120 mcg. Check it out. That's all. Use the same formula. A is equals to what? D over what? H. That's 120 mcg over 300 mcg times 1 ml. Remove the 2 mcgs. They cancel out each other, right? And what do you have? 120 over 300 times 1. 120 over 300 is 0.4 times 1 is making it what? 0.4 mils. The answer is 0.4 mils, guys, not 0.2. If you get 0.2, I need you to recalculate. It says something different up top. Where? What are you talking about? Did you look at? No. Look at where is that thing? Look at this thing. They gave you this thing specifically. Look at it. I don't know if you can see my mouse. Look at it. Why do you think this thing is colored specifically? It's colored. This thing just says 480 mcg, right? But here they are telling you 300 mcg is 1 ml. This is what you need here. 300 mcg is what? 1 ml. Each 300 is 1 ml. Each 300 is 1 ml. That's what you need. All right. So what do you mean? What do you have? Your at hand is what? 300 mcg. And mcg is the same thing with the one they gave you in the order. That's 120 mcg. That means the order becomes what? The desired. So your D is 120. Your H is 300. All right. Then your quantity is 1 ml. Your quantity is 1 ml. Listen, if you use 480, okay, listen, if you use 480, if you use 480, that means your quantity will be what? 1.6, not 1. And you still get the same answer. Funny enough. You will still get the same answer. You understand the point? It's a... What did he say? He said on a different part of the label, it says, no. So listen. When you are looking at a label, you need to look at the most important parts of a label. All right. They specifically made this color here because of this a lot of information that they gave you here. And this information is, discussing a whole lot of other things, which you don't really need. What you need is to focus on the major information that they want you to look at. And this is what for subQ or IV only, like they specifically stated it here under this filgrastim. All right. And they're telling you that single-use prefilled syringe with 27 gauge needle, is what? 300 mcg per ml. 300 mcg per ml. That's what they are trying to tell you. So you focus on this. You don't jump this and enter here, because there are a lot of information here. And if you start breaking down this information, you will get confused, which I'm not going to do right now. Right? So go with the easiest thing. Get your stuff, do your calc. Even if you want to go with this guy up here, it's still the same thing with this guy here. That's the truth. You will still get the same answer, all right? So please, let's continue. I don't want us to spend too much time on this thing. This is just... and another thing you need to know is, even if you use that 300 per 0.5 MCL, you won't even get any question in the option. You won't get an answer in the option. That's the point. All right? I don't know how to make it bigger, please. I really don't know. It's next time, make the level bigger. Yeah, funny. I don't know how to make it bigger, honestly. I just try as much as I can. So look at this, guys. Look at this. Yeah, I get it now. Understand the concept. I just look at the wrong part. Yes, please just look at the main parts, all right? So look at this part. Insulin-dependent diabetes results from Insulin-dependent diabetes results from A. I'll just give the options because it's very easy. A. Excess glucose production. B. Decreased or no insulin production. C. Decreased glucose production. D. Increased insulin production. Maybe I should just post it. This is A. Yeah, you're welcome. This is B. This is C. And this is D. Okay, guys. Oh, you guys have started answering already. Insulin-dependent diabetes results from A. Excess glucose production. B. Decreased or no insulin production. C. Decreased glucose production. And D. Increased insulin production. Answer, guys. You want to fly? We will. Truth of matter is that the calculation questions is not going to be a problem for you because all the calculations we've been doing is the same thing. Trust me, it's the same thing. So by now you are supposed to be cooked in the calculations. But how they catch you is all these other questions. No, I don't have a dog. You want to give me one? I want a dog, honestly, but it's too expensive. The kind of dog I want is too expensive. See me talking as if I know the kind of dog I want. I don't even know the species of dogs, but I just want a very beautiful big dog. I don't like the small ones. Because I turn a lot on my bed and they can be sleeping beside me and I will sleep on them. But the big one, there's no way you sleep on the big one. So if you want to give me a dog, I'm here. Good one, a trained one. You have to train it. I have a bully and I am breeding soon. Somebody wants to give me a dog. Oh, somebody wants to give me a dog. Oh. I would love dogs. So honest, the thing is that initially I don't like dogs until I went to my sister's house. Honestly, guys, if you go to my Instagram page, I need you to go to my Instagram. My Instagram is at officialdr.ray. You know my name is Raymond. At officialdoctor.ray. That's my Instagram handle. If you go down my Instagram page, you will see my sister's dog. That dog can smile. I'm not joking. I was like, Miri, smile, Miri, smile. It just did like it. I was shocked. That dog acts like a human being. Oh, Caprice. I didn't know it was you. This is the first time knowing that it's you. Baby Petrillo. Okay, now I remember. So, guys, yes, the answer to that question is the use of different injection sites. We need to get important harder questions. No. What fails people is not harder questions, it's the simple questions. That's what fails people. Like this question I want to give you now. Yeah, the answer to that question is A, guys. It's just a giveaway. Don't look for harder questions. Let me tell you, if you get all your simple questions right, you will pass your exam. So look at this question. Which of the following insulin has the fastest onset of action? A, regular insulin. B, NPH insulin. C, insulin glycine. D, insulin lispro. Which of the following insulin has the fastest onset of action? A, regular, NPH, insulin glycine, and insulin lispro. Quickly, guys. Which one is the fastest? Regular, NPH, insulin glycogen, insulin lispro. You see, for the first time, this is the question everybody got wrong. For the first time. Honestly, you see what I was telling you? The simplest question can actually be difficult. It's lispro, yes. The answer is lispro. Lispro is the fastest, and they gave you that thing to confuse you. And if you go to your slide, it's there. Funny enough. Lispro is the fastest, guys. Lispro is the fastest. All right? Yes, it's lispro. You guys are so right. It's lispro. Look at this. The time when insulin's effect is strongest is referred to as the dash. Not giving you option. No. No. Regular is fast, but lispro is faster. All right? So look at the next question. Look at the next question. Guys, click like. Thank you. Look at the next question. The time when insulin's effect is strongest is referred to as dash. Quickly, guys. Quickly. Quickly. Yes, lispro is homolog. It's homolog. Quickly, guys. Quickly. Why regular is the homolin? How this homolin are? Lispro is homolog. This leg is just disturbing me, man. It's making me uncomfortable. Yes, guys. The answer is peak. If they give you that question, it's a giveaway. You cannot fail it. So we are almost at the end of this particular thing. The next one has fewer questions, so that's why I'm not. The dash is the time when insulin begins to lower the glucose level. Quickly, guys. Okay. So that onset, everybody know onset. So I'm not going to ask you the last question. The last question is duration. That's the length of action, length of time insulin works. So I'm not going to ask you that so that will save time. Look at this question. Somebody was looking for a hard question. Okay. I don't think it's hard anyway because it's still straightforward. Look at this question. At 0830, 10 units of NPH insulin was administered subQ. What time would you expect the insulin to begin lowering the blood glucose? Yes, the answer to that one is onset. Options 0900, B 1030, C like 1030, C 1245, D 1400. What's the answer? 0900, 1030, 1245, 1400. Zero 0900, 1030, 1245, 1400. Quickly, guys. NPH is intermediate acting, right? Intermediate acting, so it's not too fast and it's not too slow. So it takes like 1 to 3 hours to start acting. So if you check 1 to 3 hours from that 8:30, what are you getting? You are getting what? 10:30. Okay, 1030. Okay, that is the answer, guys. 1030. Look at this. I told you that most of the questions that they want to test you will be more on this thing. Look at this question, guys. Options A, options B, options C, options D. There's no U50 in the option. No. Look at the options. Novalin R22 units is to be administered. Which of the following syringes would you prefer? Would be your preference? Tuberculin syringe, standard 3 ml syringe, 30 units capacity syringe, 100 unit capacity insulin syringe. Okay, the answer is C, 30 units capacity insulin syringe. All right, R22 units is 30 units. That one is very straightforward, I believe. But if 30 units is not available, 50 units will be available. That's why 50 units is not in the option, because it actually can be right. You get? So look at this one. This is the question. Let me give you the option. Cool down. Relax. Let me give you the option. Yes, that one is C. You're correct. Let me give you this option. Let me see what you will pick. That's A. That's B. This is C. And this is D. Okay, let's see. Interesting. Interesting. I need you to pay attention very well. Okay, everybody must answer this question. Everybody, if you don't know it, write not sure. Write not sure quickly. If you don't know the answer, write not sure. Don't keep quiet. You guys are keeping quiet. Okay, good. If you are not sure, it's good that you wrote not sure instead of keeping quiet. Remember, I told you that U500 insulin is very special, right? I changed my mind to see yes. And now they gave you 92 units has been ordered. Which of the following syringes would be preferred? You have to use syringe for that U500 insulin. All right. That last one now, everybody's picking D. But look at it. D says U100 syringe with 100 capacity. How can you use U100 syringe for U500 insulin? So yes. So the fact that it says specific syringe for U500 insulin makes it right. You always say, oh Lord. Hey, God. So you see, so I need you guys to be specific about it. Now, the next question they are asking here, but I don't want to post it. Let me see the question again. They said heparin is administered to. All of you know what heparin is administered to. Heparin is administered to decrease blood clotting. All right, and it's an anticoagulant, so I don't need to post it here so that we don't have don't waste time. Look at this question, guys. I'm not giving options. People receiving heparin are at greater risk for what? Quickly, quickly, quickly. So that's a bad question. When you see the question, if they give you A to D, just write go to E and write. Just put E by yourself and write. That's a vague question. Circle it. It's not vague. Anybody that is taking heparin is subject to it has an increased risk of bleeding. The answer is bleeding. All right. If you are taking heparin, I don't want to cut you. I will. If you come to my theater, I won't cut you. Except if that thing is now one emergency that I will, it's between life and death. Okay, maybe I'll just try. But trust me, they don't want to touch you because any small cut like this, you keep bleeding. Your blood is thin. So that's why we say bleeding. All right. Remember that. Look at this question. Heparin, you guys are so correct. What they asked you, they did if you are taking heparin, somebody said bleeding as a side effect or blood clot as a disease. Listen, the question is, what is that question again? Let me give you the question. People receiving heparin are at greater risk for. You are not at greater risk for blood clot. Because heparin is actually helping you to ameliorate blood clot. You are at greater risk for what? For bleeding. It's as simple as that. Straightforward. But because clot is even in the option. So don't go and pick it too. Heparin is never administered by DASH because of risk of hematoma, guys. Quick by what? Quick one. Oh, okay. So this one is a very good final question. Guys, what's the answer now? You need options. Okay. IV infusion, subcute injection, IM injection, IV push. Which one is the answer? You see this question, you use it, this picture, you use it to answer 3 questions. Yes, the answer is IM. If you because of hematoma, we don't want our patients to have hematoma. All right. Yes, because of hematoma, when you do it IM, so we don't want to give it IM. All right, that's the answer. So look at this picture. Not IAV, it's IM. It's IM. Look at this picture, guys. Look at this picture. Which of the syringes would be the best choice to administer 10 units of insulin from this option? Do you need me to zoom it? So which one? is that? What was the answer, guys? The answer is syringe 1. Please, the answer is syringe 1. Which of the syringes will be the best choice to administer 10 units? You just use a 30 units syringe. All right. The answer is syringe 1. Look at the next question. The question, I posted the question now. Go, just scroll up, you see it. Which of the syringes would be the best choice to administer 10 units? That's the question, guy. That's the question. Somebody was asking, black man, you were asking, what was the question? And the answer is syringe 1. Look at this particular one, using the same image. Which syringe would you select to administer humulin R U 565 units? You said why not 2? Are you asking why not 2 for 10 units? If you have 10 units, what do you use? You use the 30 unit syringe now, not 50 units. Why do you have to use 50 units? The distance between 10 and 50 is too much compared to the distance between 10 and 30. So that's the rationale. So which syringe would you select to administer this? Why is everybody picking 3? Have you forgotten what I told you about U500? I told you as far as U500 is concerned, you have to, that's what I mentioned when I was, I told you they will confuse you. As far as U500 is concerned, you must convert the 500 units to what? ml. And when you want to convert, 500 units is equivalent to what? 1 ml. All right? So you have to calculate the amount to administer in ml. 500 units is equals to what? 1 ml. So 65 units will be equals to what? Somebody should do the calculation. If 500 units is equals to 1, here they gave you what? 65 units is equals to what? X. So X is equals to 65 times 1 divided by 500. So somebody should tell me 65 divided by 500 is what? Please punch it and give me the answer. If you remember, I specifically mentioned that when you are doing U500 insulin, it's special. What is the answer, guys? 65 times 1 divided by 500. That's 65 divided by 500. What does it give you? So whatever it gives you, you see. So you look at that number 4, it is in mils. Number 4 is in mils. So you have to use that number 4. 0 points, whatever. You take it with that number 4. That's how to get the answer. How do we identify U500 specific? I don't know what you're asking, but if what you're asking is how do you know the syringe for U500, you will know now the syringe will be in mil. All right. Anytime you want to do U500, convert it to mil. All right. Does that make sense? Cap, it makes sense, right? Anytime you want to use do U500. Okay, perfect. Thank you so much. Yes, the answer is syringe 4. Yeah. If you look at it, all of them are in units. It's only syringe 4 that is in ml. You understand? It's humulin. We are talking about insulin. We are not talking about heparin right now. Look at this question. Look at this question. Yeah, it's humulin. Which syringe would you select to administer homolog R 4 units. Which one? Which one, guys? Don't worry, we are coming to insulin. I'll give you a question on it. Heparin, I'll give you a question on it. Which syringe would you select to administer homolog R 4 units? You say, why aren't one correct for which question? Which question are you talking about? JB, which question are you asking? The previous question says, yeah, okay, one is not correct because when you made the calculation, right? The calculation, we made it, we converted that units to what? Mil. Do you understand? One, if you look at one is in units, not in mil. 2 is in units, not in mil. 3 is in units, not in mil. You cannot use a syringe that is in units to inject something you've converted to mil. Do you understand? I don't know if it makes sense. JB, does it make sense? Okay, good. So for this one, which syringe would you use to select a homolog R 4 units? That's one. You guys are so correct. You guys are so correct. One more question there. Look at this one. Which syringe would you select to administer humulin N 65 units? Quickly, guys. Quickly, guys. Yes, you guys are so correct. The answer is 3. You guys are so correct. Yes. Look at this question. This one is just a giveaway question. It's testing the microphone and it's the last question for this chapter. This chapter has a lot of little questions and I think it's the most voluminous chapter. All right. So look at the last question there. That's chapter 14, right? Chapter 15. Okay. Which one will you use? Now you use 2 now. The answer is 2, guys. That one is normal question. It's a giveaway question. I was actually looking for this other slide, actually. It's a giveaway question. Chapter 15. Chapter 15. You said You think you thought I moved to? Let me see. Hold on. Just give me a minute. Trying to look for this slide. Okay, perfect. I see it now. Somebody say, why don't you do what? Use the what's the answer? The question says 31 units now. 31 units above 30 units. So you use 50 units now. Do you understand? You use 50 units insulin. It's straightforward now. The answer is 50 units. The answer is B. 50 units. That's number 2. Yeah, it's 50 units syringe. It's a giveaway question now. It's very straightforward. Is there any problem with it? I don't know which one is 50% though. All the chapters are coming out, at least. You know, some chapters may be greater than some with maybe 5 to 10 questions or 5 questions. But all the chapters are always coming out. You know now. You know how it is. For people that are in my class, you know what I'm talking about. I thought you moved to stand because it was quiet. Yes, now it's quiet now. Is there noise? Is it because of the dog? No, that dog talks like this once in a while. Though. He's just discussing with his, I think the dog is asking a girl out. That's why he's making this noise. All right? So, but it will calm down. I don't know whose dog it is, actually. But it's not a constant thing here. When I was in Brooklyn, I almost died now because of noise. At least here, you hardly hear noise. And I'm not even using a mic. Do you understand? If it's in Brooklyn, if I want to do this class, I'll use a mic that will filter the noise. But right now, I'm not using a mic. I'm talking directly to you. Okay, guys, let's... so I'm going to take 10 minutes for this. So meaning that I'm not solving anything. I'm rushing through it. All right? So that you just know what it involves. Let me see. You are so specific about this 50% of this, and I don't know. I don't know. All the chapters are coming out, all right? So you don't need to stress yourself much. Now, for this chapter, you need to think about central line, drip chamber, flow rates, heparin log, hepatonic, blah, 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 infusion pumps, intravenous, KVO, TKO fluids, maintenance fluids, and the PCA. That is patient controls anesthesia. They will ask you questions from this as well. Then Porter cat is very important for you to know what Porter cat is. PICC, that's peripheral inserted central catheters, all right? Primary lines, rate controllers, extremely important. You see these little things, they always ask it. You understand? So you need to know what you are dealing with, all right? Look at here now, like 5% dextrose in lactated ringers. It can be D5LR, it can be D lower script 5 LR, it can be 5% D over LR, it can be D5% LR. They can write it in any way. You should understand what they're talking about. These are the abbreviations. We have D10W, that's 10% dextrose in water. We have D5W, that's 5% dextrose in water. I know I speak very fast. I'm sorry, but I need to be fast. We have WH2O. We have a NS or NSS, right, which is what? Normal saline. That's 0.9% normal saline. We have LR, lactated ringers, or RL, ringers lactate, all right? Then we have a half NS or half NSS, which is what? Half 0.5, because NS is 0.9, right? Look at it here now. NS is 0.9%. So half of NS will be what? 0.9 divided by 2, which is what? 0.5. 45 rather. Then 1 over 3 NS is 1/3 normal saline, which is 0.3%. Then 1 over 4 NS is all this. If you just see 1 over 4, just divide by 9 by 4. See 1 over 3, just get 0.9 by 3. 1 over 2, divide 0.9 by 2. Check it out. It's the same thing. Do you understand? So it's very straightforward. All right. Okay. Now, normal saline contains 0.9% saline, right? Contains 0.9% of sodium and chloride per 100 ml. That's what it means. Remember, 0.9%. You remember percent? Percent, gram in ml. It means it contains what? 0.9% of this thing, sodium chloride, in 100 ml. That's what it means. You see 0.4%. What does it mean? It contains what? 0.45 grams of what? And sodium chloride in 100. So it's actually very straightforward for you guys to know. And when you want to make a choice of electrolyte to give, it depends on what the patient has, what is wrong with the patient. Remember what we know, what we call isotonic solutions. What are isotonic solutions? Equal osmolarity in and out, all right? Inside the cell and outside the cell, all right? So that's isotonic, All right. So IV isotonic D5W NSLR. So if you see D5W, if you see NS, if you see LR, all of them are what? Isotonic solution. They will ask you which one is isotonic solution. By now, I expect you to know it. Hypotonic solution. Hypotonic solution. Which one is less than 5%? 0.5%. Isotonic from 0.5 to 0.9 something. That's iso. Iso. Above that, it becomes what? Hypertonic. Below it becomes hypotonic. It's as simple as that. You see, 0.45% normal saline, 0.35%, 0.225, all of them are less than 5, 0.5, right? So meaning that all of them are what? Hypotonic. They have low concentration of or low osmolarity. Now, hypertonic, you see, 3%, 5%, they are above 1. That's hypertonic. Okay. So you need to know where to give which, you understand, so that you don't kill somebody in the clinic. Please, don't kill anybody. So we have additives like medicine, electrolytes, and nutrients. All right, we can mix, must mix, if not what? Pre-packaged. Very, very important. Okay. Why is this thing not moving now? Oh Lord. See that thing I'm telling you? The thing stopped moving. Let me see if my mouse will move it. Finally. See that thing I was telling you about changing this laptop? I need to change this laptop. ASAP. The laptop is telling me, change me, change me. I've used it for almost 6 years. And I'm very emotionally attached to the laptop. Anyway, so before combining any medication, electrolytes, or nutrients with an IV solution, be sure the components are compatible, right? So that you don't go and give somebody something that will kill the person. All right? These are incompatible medications. Like ampicillin, you cannot put it in dextrose 5W. 5% dextrose water. You can't put ampicillin there. You can't put diazepam in potassium chloride. You will kill somebody. You can't put dopamine in sodium bicarbonate. You can't put penicillin in heparin. Or even vitamin B complex. You can't put tetracycline in calcium chloride. All right? So you need to know which one you cannot put so that you don't come and kill somebody. Please. All right? Now, we have something we call primary line components. The bag, the tubings. All right? We have drip chambers, clamps, injection ports, blah, blah, blah. You need to know these areas. They can give you diagrams like this for you to be able to identify the parts. Like this is drip chamber, this is injection ports, this is roller. Extremely important that you know these things. Now we have tubing. The tubing can be micro tubing or macro tubing. These people are telling me to pay for this thing. Okay, we have tubing, we have macro tubing, and we have micro tubing. Macro tubing, larger drops. Micro tubing, smaller drops. Check it out. Infusion rate for macro is 80 ml per hour or more. Infusion rate for macro. Infusion rate for micro, less than what? 80 ml. And KVO. Pediatric and critical care IVs. Extremely important that you know this thing. Now you have secondary sets. So this is primary sets, the first one. This is primary set, this middle one. And these two are what? Secondary sets. All right? Extremely important. It has its own role. And when you are hanging fluids, you should hang it 36 inches above the patient's heart. So you put it there. Don't put it the same level as the patient's heart. All right? Adjust the flow rate, adjust everything. Now, this rate controller, they will ask you in your exam. It is the one that uses what? Gravity. That's what they want to ask you here. It uses what? Gravity. So if you see anything that uses the rate controller, just go and look for the option that says gravity. That's what they will definitely ask you. So we have infusion pumps, all right? They have alarms, they have everything that you can think of. Then we have syringe pumps. We have volume set control. Very, very important for accuracy. Then this is peripheral line, peripheral IV therapy, all right? Assesses the circulatory system through a peripheral vein. It can be the hand, it can be the forearm, it can be the foot, it can be the leg. All of them are what? Peripheral. So if they ask you what is peripheral, you know they are talking about the hand, forearm, and what? Foot. Very, very important. Now they can ask you what is central. Central, you are targeting what? These serious veins, the major or the major veins. You are trying to assess them. The jugular, the subclavian. Extremely important that you know this. Now, You can use it for patients when you want to do rapid infusion or large amount of infusion, or highly concentrated infusion or long time IV therapy, right? Okay, then we have the PICC. They will ask you, PICC, peripherally inserted what? Central catheter. Peripherally inserted central catheter. Then we have the port arcades, which are surgically placed under the arm for access to central what? Vein. So you must know the difference between PICC, port arcade, central line, and peripheral line. Extremely important that you know these things. Please never flush. Never flush. And also, when you are giving your patient drip, look for infiltration if there is any. Some patients may not complain because they will be trying to macho it, trying to act tough. Please look for pain, infiltration. What is infiltration? Usually when there is pain or swelling at the site, right? It can lead to infiltration or what? Phlebitis. Infiltration, what are the signs? Swelling, discomfort, coolness of coolness at the infiltration site, sizable decrease in flow rates. Guys, look at the signs. They will ask you, one of the following is not the signs of infiltration. Look for the one that is not here. All right? Or one of the following is a sign. These are criteria which you should look at later. All right? This grade 1, this is grade 2, this is grade 3. This is grade 4. You should know what happens in grade 4, skin, blanched, translucent, and leaking, and all those things, all right? This is INS infiltration, grade 4. Terrible looking. I need everybody to look at it. It's looking gross. I don't want only me to see it. I want all of us to participate in looking at it. Who is sleeping? Yes, hey, this thing it has stopped moving again. It has stopped moving again. Okay, it has started moving again. Come on now, I don't have time for this. I will answer you guys your question, all right? Let me finish up this thing very fast. This thing is, because this thing is hanging and it will hang. It has hanged again. Immediately I go out and come in, it just hangs. Don't worry, I'm getting a new laptop. I've made up my mind. Okay, calculating flow rates, right? We have macro tubing and we have micro tubing. Macro tubing and micro tubing. For macro tubing, larger drops, drop factors, 10 drops per mil, 15 drops per mil, 20 drops per mil. They will ask you this question. That's macro. They will ask you which one is not macro. Micro is what? 60 drops per mil. How come ATI says 60 about macro? I don't know what ATI said, but the right thing you should know is, just like the other day I was teaching somebody neuro. The person said, how come so and so said abovita is in cerebrum instead of cerebellum? I said, I don't know whatever you read says, but what I know is the correct thing, and the correct thing is abovita is found in the cerebellum. And later the student came and said, oh, professor, you said it. I said, yes, I told you. So the thing is, macro tubing, 10 drops, 15 drops, 20 drops. Micro tubing, 60 drops. All right? Please, I'm trying to tread carefully so that this thing will not hang. You need to know this formula, guys. If it's not in your head, put it in your head right now. You need to know this formula to convert flow rate in ml per hour to drops per minute. To convert flow rate in ml per hour to drops per minute. Small f is equals to capital F times C, which is calibration factor, over what? 60. And capital F is in hour. Small f is what? In minutes. So you should know which one they gave you and know where to put it. That's the formula. You have to put it in your head right now. All right? For example, they say find the flow rate in drops per minute. You see? They gave you the capital F, which is the drop per minute, which is 35. All right? Then they gave you the C, which is the drop. That's 60 GTT per drops per mil. Then you just do your calculation, you get your answer, and you leave the exam hall. This is the same, solving the same thing using dimensional analysis method. I'm not talking about it. Okay. Now you can adjust flow. You can come into a patient that you see that, oh, this thing is not moving as it should move. Then you have to adjust it. And how do you adjust it? Right? Counting drops, adjusting flow rates, counting drops. Check IV hourly to see if it's on schedule. Before adjusting the rate, check the facility policy of adjustment. You don't just jump in and adjust. All right? You have to check. If you are new in that facility, ask question. The rule to adjust the flow rate, check the guidelines to determine if you are allowed to adjust the flow rates. Sometimes some hospitals will say you are not allowed to adjust, just leave it. All right? But if you are allowed to adjust, check their policy, then follow the rule. To recalculate the infusion rate in drops per minute, use the volume remaining. Mind you, volume what? Remaining in the IV and the time remaining in the other. Volume remaining in the IV, time remaining in the other. Then you use this formula. Formula is small f equals to what? C, calibration times V, the volume remaining over the time remaining. I hope you guys get it. To recalculate the infusion rate in ml over H, use the volume remaining in the IV and the time remaining in the other, and use the following formula. So you need to know where to apply which formula. All right, this is an example which I'm not going to discuss right now. We'll discuss it in a proper question. Oh, Jesus. Ah. You see that moment when you are pissed off about something? That's what this stuff is doing to me right now. It's making me pissed off. I don't like being pissed off. Okay. So you use your formula to adjust, all right? We'll calculate it when we come to the equations. Infusion time and volume. It is not specified in the order. You may have to calculate, all right? Duration, that's why we did duration that time. Fluid volume. You may have to calculate duration and fluid volume. To calculate the infusion time in hours, T, identify what? Your volume. Identify your what? Your flow rate, right? Fractional hours expressed in minutes by multiplying by 60. Fractional hours expressed in minutes. How do you express it in minutes? By multiplying by 60. Then you use the formula T is equals to V over F to find what? T. T is equals to what? V over F to find T. Remember, this formula is just, they just cross multiplied, because usually the main formula is F is equals to V over T. But this is cross multiplication. Now you are looking for T, so you cross multiply. If you are looking for F, you cross multiply. If you are looking for V, if you cross multiply V here, V will become T times F. So it's just cross multiplication. I hope you guys understand this, because this is what we've been doing since morning, since whenever. All right. So this is a equation that you can look up later. Now, to calculate the time when an infusion will be completed, you must know what? The time the infusion started and the total time to infuse the solution. Simple. If you want to know when it will, when the infusion must be completed, you must know how many minutes is this infusion supposed to take and when did it start. Very important for you to know. Oh, what happened? We've dropped from 45 to 35. 10 people ran away. What happened? Is it getting too difficult? You see what I was telling you about V? Just cross multiply. V is equal to T times F. Check it now. It depends on what they give you in your question. All right? 35 people. Now, they ran away. This thing is still hanging. I'm so sorry, guys. So sorry. I don't know what's wrong with my system. It has been acting like this for some days. Maybe I'll just go and buy a Mac. But all the Mac I'm seeing is so expensive. 2007, 3,000. The ones I like anyway. It's too expensive, unnecessary. I hope it will be worth it. Because if it's not worth it, I'll just throw it away. Okay, so we have intermittent IV infusions. Somebody's laughing. Caprice is laughing. Intermittent IV infusions. IV medications may be administered intermittently with or without continuous IV therapy, delivered through secondary lines, saline, log, or heparin. Sometimes you can just pause an IV, right, to inject something else. So that's when you use all those other lines. So this may be delivered through saline or heparin logs, all right? So remember that. So saline log uses saline as flush. Heparin log uses heparin as flush. Okay. So this is the stuff here. Select the correct strength of heparin for an intermittent flush. All right. Don't just take a lot of heparin and pour into the patient. So when preparing medication for an intermittent IV flush, reconstitute the medication using the label and packaging site. Calculate the amount to what administer and the flow rate. You must calculate it, and the flow rate. Very, very important. All right. Okay. Don't worry. We'll see a question based on that. Let's see what I get. Okay. This is practice. This is summary. Okay, I think that is it. We are already in summary, so I think that is it. So let me remove this before it hangs the entire thing. He said my laptop made them run away. The exam will make them run back. Anybody that's running away, the person had to make sure that whatever you are running to is worth it, because you can't joke with these things. Okay, guys, I'm so sorry about that laptop. It's just annoying. It's terribly annoying, and I don't have an option. So by next week, I'll get one. So flutes. So that is it for chapter 15, right? Yes. Say there you go. breather. Okay. So number one question. Guys, everybody, okay, they are back. Really? Maybe the laptop chased them away. So please, I need everybody. You need to be active and engaged, all right? Everybody, so that you don't sleep. If you stay like this and you're looking at me, mathematics will make you sleep. Dosage calculation will make you sleep. Don't sleep. Fluids given to maintain a patient's a patent vascular access are called dash. A, replacement fluid, KVO fluids, therapeutic fluids, maintenance fluids. What's the answer, guys? Quickly. What's the answer? Quickly, guys. Replacement fluids, KVO fluids, therapeutic fluids, maintenance fluids. What's the answer? Yes. KVO means keep vein open. Okay. So that's testing the microphone. Testing the microphone. Let's see. Yes. KV. Yes. Keep vein open. Yes. Still testing the microphone. This Zinacef 750 mg IVQ that Q8H is ordered every 8 hours. It's ordered. This would be what type of IV infusion? We have replacements, we have KVO, we have therapeutic, we have maintenance. Which one is it? Which one is it? Quickly, guys. Replacement, KVO, therapeutic, maintenance. So let's go very quick. These questions are actually easier. Yes, the answer is therapeutic, all right? The answer is therapeutic. Look at this. Lactated ringer solution does not affect the fluid balance of surrounding cells and tissues. Therefore, it is classified as dash solution. Which solution is lactated ringers? Quickly, guys. Yes, you guys are so correct. The answer is isotonic solution. Anybody that doesn't know that should know it now. The answer is isotonic solution. We are still testing the microphone. Yes, ISO. You are so correct. I like the fact that a lot of you are contributing to this discourse. Conditions such as dehydration would warrant the infusion of which type of solution? Conditions such as dehydration. When your patient is dehydrated, which infusion will you give that patient to treat the dehydration? Interesting. If you're not sure, you can just write not sure, guys. Quickly. More. More, guys. I am second guessing, by the way. Okay, so the answer is actually hypotonic, all right? Because I have a valid reason that doesn't make sense via text. Cap, what are you talking about? So the answer is hypotonic solution, guys, all right? Because when you give a hypotonic solution, the cells will drag the water inside the cell, and we need water inside the cell. You understand? So conditions such as dehydration will warrant infusion of hypotonic solution, all right? Not hypertonic, not even isotonic. How come it's hyper? I didn't say hyper, it's hypotonic solution. That patient lost water, right? He lost a lot of water. You understand? So you have to give what? Meaning that the patient is hyper at that moment, highly concentrated. So the inside cell is highly concentrated. So what do you do to that patient? You give the patient low concentrated water, or water that has low electrolyte concentration. You understand? So immediately you transfuse the hypo to the patient. The internal environment of the patient that is hyper, we drag the water inside it. You understand the point? Look at it, picture it this way. When they say, somebody is dehydrated, do you understand? Dehydrated. We are talking about the cell. You understand? We are talking about the cell. So there is low water there, but high salt. So because of that, you need to give water into the cell. So what do? You give a low salt concentrated water to that patient. Then the cell will drag that water inside. If you give a hypertonic solution to that patient, what will the hypertonic solution do? The solution will drag more water from already dehydrated cell out, and it will make the cell shrink. So you need to understand this thing very, very well. What you need to learn is what is hypertonic, what is hypotonic. Then you will now understand the fluid to give. If there is too much salt inside the cell, why will you give a solution that has too much salt? You kill the patient with dehydration. So when there's too much salt and low water, what do you give? You give the one that has what? More water and less salt. It's as simple as that, so that it can balance the equation. Remember, what you are trying to do is to balance the equation. I hope it's clear, Sha. But the answer is hypotonic solution. When somebody is dehydrated, please give hypotonic, not hypertonic solution, and not even isotonic. If you don't understand it, I will still explain again. But as you are thinking if you understand it or not, let me give you another question. When mixing additives to an IV solution, checking for compatibility is essential because incompatibility of additives, if someone has diarrhea or vomiting, what should you give the patient? When you have diarrhea or vomiting, right, that patient is losing fluid and electrolyte. So you give the person isotonic solution. That's why we give normal saline. I don't know if you understand. That's why you give normal saline. Does it make sense to you? You understand? So that's why you give normal saline. Don't worry, I'll treat you on those ones when we get to anatomy. When we get to anatomy. All right? So dehydration is different from you are losing electrolytes, right? The dehydration is that you lost water, not electrolyte. But when you are vomiting, you are losing both water and electrolytes. So you are losing both water and electrolytes. I can't give you hypotonic solution, and I can't give you hypertonic solution. Instead, I'll give you isotonic solution because you are losing electrolyte and water equally. So I just give you something that's equal. That's normal saline. I don't know if it makes sense to you. But when you are dehydrated, you lost only water. You didn't lose electrolytes. Makes sense now, right? You dehydrated, you lost only water. You didn't lose electrolytes. So because you lost only water, you didn't lose electrolytes. I'll give you something that does not have electrolytes. It's just like me giving you drinking water. Just like if I'm dehydrated, what do? I drink drinking water. But when somebody is vomiting and they're having diarrhea, what do you give? You give the person normal saline. Make sense, guys? Let's leave it at that, guys. When you get to anatomy, when you come over to anatomy, we'll do more. I'll take time to break down anything hypotonic and hypertonic, and you will never, forget it. In short, I will do it in my channel, but I'll put it in the member section. So if you're not a member of the channel, try to go and subscribe and be a member of the channel. Special member group, very special. There are some things I'll be posting for you to clear you some of these doubts, all right? Some of these little information that if you have it, if you know it, you've known it for life. This person is still asking a lot of questions. We'll get to LR. Okay. I don't want to deviate. This is 229. We'll get to LR. Lingers, what you ask yourself is, Lingers lactate or lactated Lingers is what? Is it an isotonic solution, hypertonic or hypotonic solution? Do you understand? When you know what it is, then you know when to give it. It's as simple as that. You understand the point, which is what we did when I was teaching you. You have to know, is it hypertonic, hypotonic, or isotonic? He said, how much? To be a member of my channel, I don't know, maybe $5 or $2. I don't know. But it's just something that is very, very not this thing. I don't know. I just saw it on YouTube some days ago. Please, let's continue. You are stopping me from moving ahead. When mixing additives in IV solution, right? That's where I stopped. Let me see. When mixing additives to an IV solution, you can't have me for AP. Leave this one first. Whether you have me or not doesn't matter. AP is AP. You must always come to the channel for life. That's why you need to click notification bell, because the same question you do is the same question you do no matter the professor that is teaching you, no matter the school, no matter the country. If you know it, if you know hypotonic solution, you know hypotonic solution. If you know hypertonic solution, you know it for life. No matter the hospital you work, no matter the professor that teaches you, no matter the country where you are, no matter the medical school, no matter the course you are studying, it's the same thing. So you must always come back to the channel, trust me. Please, that question, when mixing additives to an IV solution, checking for compatibility is essential because incompatibility of additives. Let's go, guys. Let's go. Let's speed up. A, is more expensive. B, may compromise the patient's health status. C, requires additional base solution. D, requires less base solution. When mixing additives to an IV solution, checking for compatibility is essential. Why is it essential? Because incompatibility of additives, dash, A, is more expensive. B, may compromise the patient's health status. C, requires additional base solution. D, requires less base solution. Quickly, guys. Quickly, guys. Yes, you guys are so correct. The answer is B. May compromise the patient's health status. It has nothing to do with being expensive. It has nothing to do being requiring additional beds or whatever. All right. Now we are still testing the microphone, and I want us to be very fast in this testing the microphone, so that we can move. All right. Pain and swelling near an IV site may indicate A or and dash. Pain and swelling near an IV site may indicate an. Listen to the options. A. Incompatibility of additives, incorrect flow rates, improper base fluids, infiltration of phlebitis. I'll take the options again because some people will say repeat. Pain and swelling near an IV site may indicate A or incompatibility of additives, incorrect flow rates, improper base fluid, infiltration of phlebitis. The answer is D, infiltration of phlebitis. The answer is D. Yes. Okay, for people that, yes, the answer is D, guys. Look at this question. Micro drip tubing has a drop factor of what? Answer. No options. Yes, you are correct. Somebody says phlebitis. Yes, you are correct. Okay. Micro drip tubing has a drop factor of what? Quickly, guys. Quickly. I want everybody to be active and engaged. This is the questions to shine. Yes. No, not 10, 15, 20. 10, 15, 20 is macro. This is micro. Micro is 60 drops. Please, it's fine that you made that mistake here. Don't make it in the exam hall. All right? Here they are asking you micro. So be specific. Because trust me, 10, 15, 20 is in the option. And they even came before the 60 because they want you to just choose it. You understand? So don't let them catch you. One question matters a lot. All right? Thank you. So patients not requiring continuous IV infusion may require A, piggyback, B, intermittent peripheral infusion device, C, secondary line, D, primary line. What is confusing you? Patients not requiring continuous IV infusion may have A or a piggyback, B, intermittent peripheral infusion device, C, secondary line, D, primary line. For micro, 60 drops. Micro, 60 drops because it's small. So it can drop up to 60. Macro is large, 20, 10, 15. I think it's straightforward. If you have any confusion, you can also ask. All right. So, what's the answer to this one, guys? Quickly. Piggyback intermittent peripheral infusion device. The answer is intermittent peripheral infusion device. You are welcome. The answer is intermittent peripheral infusion device. All right, because it requires continuous intravenous what infusion, or rather, the patient does not require continuous intravenous infusion. So, because of that, just put intermittent peripheral infusion. Anytime it requires, maybe it requires one now and tomorrow and next tomorrow. Do you understand that kind of thing? But somebody that requires continuous, you can't put intermittent. Okay. Please, I need these guys to remember that. Aha. The answer is intermittent this thing. The answer is intermittent peripheral infusion device. IPI. Look at this question. Hypertonic solutions are generally given to patients A, with dehydration, with normal electrolyte level, who are healthy but having diagnostic tests, with low electrolyte level. Answer. Hypertonic solutions. A, with dehydration. B, with normal electrolyte level. C, who are healthy but having diagnostic tests. C, with low electrolyte level. Hypertonic solutions are generally given to patients with dehydration, with normal electrolyte level. C, who are healthy but having diagnostic tests. D, with low electrolyte levels. Yes, the answer is D, guys. Low electrolyte level. See what I was telling you before? If the electrolyte is low, give hypertonic solution. If the electrolyte is normal, give isotonic solution. If the electrolyte is high, give hypotonic solution. Check it out. All right. This question, everybody will get it. I don't see why anybody will fail this question. I won't see. In short, if anybody failed this question, somebody said repeat. What was I saying? What did I say before? I was talking about hypotonic, right? So hypotonic solution is given to somebody that has high electrolytes. Hypo. Normal electrolytes will give isotonic. Low electrolyte will give hypertonic. All right. So look at this question. Which of the following is not a drop factor for macro drip tubing? We have 60 drops, 20 drops, 15 drops, 10 drops. Answer. You said I should repeat. What did you say I should repeat? I just repeated it now. If you don't understand it, you can. Okay. You got it. Okay. So, which of one is not a drop factor for macro tubing? 60, 20, 15, 10. 60. You guys are very correct. You see, that's how simple this question can be. Very simple. Look at this question. And I shouldn't be giving option for this particular question, but I will because the Spirit of the Lord is within me right now. Which of the following devices relies on gravity to infuse the solution? Syringe, infusion, syringe pump, infusion pump, rate controller, PCA devices or device. Which of the following devices relies on gravity to infuse the solution? Syringe pump, infusion pump, rate controller, PCA device. Come on, guys. Which one of the following devices relies on gravity to infuse the solution? Syringe pump, infusion pump, rate controller, PCA device. The answer is rate controller. I told you before when I was teaching, explaining this paragraph, I mentioned it. I said anywhere you see gravity, go and choose the rate controller. Do you understand? That's what I said. These are little informations you need to pick up. No, not infusion, not infusion. Not infusion, cap. Not infusion, the rate controller, all right? So just, yeah, it's good that you answered it now and fail it so that in exam you can't fail it. That's why I said type. Even if you answered wrongly, you will remember. If you see that kind of exam equation, just imagine you see equation, they're telling you gravity. Even if you want to put infusion pump, your brain will say, no, no, no. I put infusion pump yesterday and they told me I'm wrong, right? And immediately you say, okay, it's rate controller. You choose rate controller. That's the idea of picking an answer. Look at this question. So the answer is rate controller, guys. Look at this question. A or and dash is usually used to deliver a medication that must be administered within 30 minutes, although longer time periods are possible. This person is so interested in how many questions. I don't know. I don't even know who this person is. I'm so interested in how many questions. First of all, he started asking me how many percentage is the first one. Now he asked me how many questions. Any questions you see, you can see 100. You can see less than 100. Anything you see, you answer. Do you understand? My people in my anatomy class the other day, I gave them questions. I told them 100. That they will see 100 questions in the exam. And I woke up that morning to set the question. And the Spirit of the Lord ministered unto me. I played too much. And told me, Nchebe, make it 110. I made it 110. For real. But funny enough, they passed more because of more questions. And it's logical. Because when I made it 110 questions for 100 marks, it means that one question is 0.9 something. Right? So if you fail one question, you can still get a 99 points, 90 something marks. You understand? Imagine I decide to say, okay, I'm going to give you guys 25 questions. It means that one question has 4 marks. You fail one question, you are automatically in 96. Just one question that you failed. So I don't like that. I like to give a lot of questions so that, for people that are in my class, I always give a lot of questions to reduce the power of each question. You understand? To give people more chances of passing. All right? Say, sounds like a judge. Okay, so what did I ask? A or and dash is usually used to deliver a medication that must be administered within 30 minutes, although longer time periods are possible. A, rate controller, syringe pump, PCA pump, infusion pump. What's the answer, guys? Nobody has answered this question. What's happening? I should repeat what? The option? Rate controller, syringe pump, PCA pump, infusion pump. Okay, guys, to save our time, the answer is B, please. Please, if you don't know it now, just know it now. Syringe pump. Syringe pump is usually used to deliver a medication that must be administered over what? Half an hour or less. Though sometimes longer period are possible. If you just see that question like that, it's always talking about syringe pump, not infusion pump. Not infusion pump. Infusion pump can last a very long time. But syringe pump is usually what? less than 30 minutes. Though you can still use it for just a little above 30 minutes. All right. Please, the answer is syringe pump. Okay. Look at this question, guys. Very, very fast. A lot of people didn't answer the other question. So let me see if this one will motivate people because it's easy. Which of the following is not a sign of infiltration? Which one is not a sign? Redness, pain, swelling, coolness. Which of these following is not a sign of infiltration? Redness, pain, swelling, coolness. Redness, pain, swelling, coolness. Redness, pain, swelling, coolness. Okay, please, the answer is redness. You understand? If you look at it, there's always swelling. Sometimes there's pain. There can be pain or no pain. There can be swelling or no swelling. There can be coolness or no coolness. But there's never redness. You will never see it red. All right? Okay. So I want you guys to write this thing for me. Write this thing for me, guys. Yes, the answer is A, guys. You're so correct. Write this thing for me. So that's the question. And that's the options. Flow rate in milliliters per hour can be calculated using the formula. Which formula? That first one is F times C over 60. That thing is over 60. Like everything over, where is over? Yes, over 60. Somebody said not again. Nchebe has come again. Oh Lord. I know you didn't put oh Lord, but in your mind you put oh Lord, right? It's like, oh Lord, what is this again? I thought I'm done with this thing. Quickly, guys, quickly. Quickly, oh my people. He said yes. Quickly, guys. We have stuff to do. Just pick an answer. You will see the formula. You will see it. That from day one, I was begging you to put these formulas in. You will see it. Trust me, you will. So the earlier you learn it, the better. It's very straightforward now. Flow rates. Everybody, flow rate is something you should know now. In hour. Flow rate in hour. What's the answer? Yes, the answer is C. Oh, okay. Sorry. That's C. No wonder people were finding it difficult to pick. C is V over T. You're correct. I didn't put it well. Yes, the answer is C. You guys are correct. F is equals to V over T. All right. You guys are so correct. Now look at this one. Yes, I know. It was when I copied and posted, the division sign didn't show. So look at this one. This is V. Let me do it properly. I don't know why when I copy it, it's not. This is over. This is over. I think this is better. So flow rate in milliliters per hour can be calculated using the formula small f is equals to capital F times C over 60. Small f is equals to capital C times V over T. Capital F is equals to V over T. D, V is equals to T times F. Answer, guys. Answer, guys. Yes, the answer is A. All right. Which of the following is used to determine the flow rate in drops per minute? The answer is what? A. F is equals to what? What did I post? Hold on. Yes, F. Small letter F is equals to capital letter F times C over 60. Yes. Why is my life here? I am wrong. No. No. Honestly, when I put question here, I'm already looking at the next question to give. Right? I'm already, because I want to be faster. I'm already looking at the next question to give. So if you see me smiling, sometimes it's not about you. All right. So the answer is A, guys. So you need to know what is the difference between the other one and this one. This one is talking about flow rate in drops per minute. The other one is talking about in what? Flow rate in per hour. Does it make sense? Per hour, per minute. So I need you to compartmentalize it in your head. If you hear per minute, right, that means you're talking about drops. Immediately you see drops, you must see a C. You know that you're talking about small letter, all right, small letter F. Very, very important. So, okay, look at this question, guys. Look at the question here. To adjust a flow rate, you will need to calculate the infusion using what? I'll give the options and I'll post. Oh, I like this method I'm not using, because this thing, it looks bolder for everybody. Look at the options here. This is A, this is B, this is C, and this is D. To adjust a flow rate, you will need to calculate. What's the answer? A, the remaining volume and the original volume. B, the original volume and the remaining volume. C, the original volume and time. D, the remaining volume and time. What's the answer, guys? Yes, the answer is what? D, the remaining volume and what? Time. The remaining volume and what? Time. So look at this question. Yes, the answer is D, guys. Look at this question. That's the question. I know somebody is so angry right now with me. Nchebe, why the hell are you posting formulas? I'm sorry. Why is he not posting? Hold on. Oh, no. Hold on. That's not the question. I thought this thing copied, but it didn't copy. Yeah, just hold on, guys, please. This is the question here. He said, what's the answer to what? Sorry. Is it to the earlier question? The answer is D, the remaining volume and time. I mentioned it. The answer is D, all right? The remaining volume and time. So look at this one. Look at this question. I'll give you the options. What's the answer, guys? So the formula for calculating an infusion requiring adjustment is A, F, small f is equals to capital F times C over 60. Small f is equals to C times V over T. F is equals to V over T. And V is equals to T times F. Answer, guys. When you want to recalculate an infusion requiring adjustments, come on, guys, you need to attempt this thing. Oh, you really need to attempt it. You can't keep quiet. I am confused. Please, what's confusing you, my friend? What's confusing you? Feel free, talk to me. Louis, what's confusing you? Talk to me. The formula for recalculating an infusion. When you're recalculating an infusion, right, you are recalculating the amount of the flow, the amount or the flow to give, right? So it's not even D. D is even out of the equation, guys. D is just formula to calculate volume, all right? And D is just, you get it from cross multiplying the F over the V, F is equals to V over T. That, in short, C and D is the same thing. Funny enough, C and D is the same thing. All right? C and D is the same thing. And we already discussed about A. Where do we use A? Where do we use A? We use A when you want to determine the rate, the flow rate in drops per minute. That's where you use A. So meaning that the A is flow rate in drop per minute, right? The C is flow rate in hours. V is the same thing with them. So the three of them are the same thing. The answer is C. The answer is B, rather. You need to understand it. F is the same thing as option A, and option C is the same thing. The only difference is in option A, you want to calculate flow in minutes. Option C, you are calculating flow in hours. The same thing. Check it out, you see? Why option F is still the same thing? It's just that this is talking about volume. So your answer is C. So sometimes your answer is B. B, please, B. A and C is the same thing. The same thing with D. Your answer is what? B, which is what? Small letter f is equals to C times V over T. That's how you do your recalculation, readjustment. And your V over T is the new volume, the remaining volume, and the remaining what? Time. V, the remaining volume, and T, the remaining time. While C is the drops. So that's your formula. We discussed it when we were doing the lecture. When I was doing the lecture some minutes ago, we discussed it. Please, your answer is B. Anybody confused? No. You say, wow. No, but sometimes, like, let's assume you don't even know the answer, right? But if you see A and see F, you are sure that they cannot be the answer because they are the same thing. Do you understand? And V is just taken from, and the D option is taken from the B. Still the same thing. So the only odd man out is B. So B should be the answer. You say what? C? C is F is equals to V over T. That's when you are calculating flow in per hour. While A is when you are calculating flow per minute. So they are the same thing. It's just the difference is just do you want an hour calculation or do you want per minute calculation? You know what I'm saying? Okay. I hope nobody will fail that question now. So if you want to, this is annoying me. So I want you guys to write this thing for me. You can use the dash to calculate infusion time in hours. Which formula will you use to calculate the infusion time in hours? Quickly, guys, quickly. I'm not giving you options. Somebody says C. C? Which question are you answering? No, guys. I don't know. Which question? Are you answering the other question or this one? No, this question I asked is not for this one. Let me clean it. Because this one, you guys are already saying C. I didn't give options. I'm not giving options. I say you should write the formula for me. The formula for, what did I ask? Which formula do you use to calculate infusion time? You are saying C. We are asking you time. You are saying C. That option C, is it time? The option C there is F. You are saying T. So that one doesn't even count. So I want you to write the option for me. Write the equation for me. Quickly, guys. Quickly. Somebody has already written. So quickly, guys. What's happening? Just cross multiply now and give me the answer, man. Okay, somebody said T is equal to V times F. Somebody said T is equal to V over F. Volume over flow rate. Keep going, guys. Keep going, guys. I've written it, so just pick. Which formula will you use to calculate infusion time? So you guys are so correct. The answer is A. Time is equal to V over F. It's just cross multiplication. All right? It's just cross multiplication. Okay, I need you to tell me which one will you use to calculate volume? The same options. Which one will you use to calculate volume? Which one will you use to calculate volume? You see how they will bring these questions? This is how it will, you know, they will bring it. Quickly, guys. Yes, the answer is V equals to TF. All right. So look at this question. Look at this question. Flow rates are generally not adjusted more than, look at the options, 25 drops over or under the original flow rate, 25% of the original flow rate, 50% of the original flow rate, 5 drops over or under the original flow rate. What's the answer? A, B, C, D. Flow rates are generally not adjusted more than. Quickly, guys. Quickly, guys. What's the answer? When you are adjusting, what is the highest boundary you cannot go beyond? That's what they're asking you. Please, the answer is B. 25% of original flow rate. You cannot go beyond that. That's what they're asking you. So look at that thing I was telling you initially. Please, the answer to that question is what? B. You cannot go more than 25% of the original drop. Original flow rate. You can't go more than that, all right? The answer is B. Some people are choosing D. Please, not D. D says 5 drops over or under the original flow rate. Nah. We don't care about the drops. What we care about is the calculation of that flow rate. The rates, all right? Calculate that flow rate. Anything you get, all right, make sure it doesn't exceed 25% of the original flow rate, all right? So look at this question, guys. Say it again. 25% of the original flow rate. You cannot go beyond that, all right? So look at this question. Patients with original electrolytes, with normal electrolytes levels are likely to receive which type of solution? Quickly, guys. This kind of, don't worry. If you get it wrong, that's fine. That's fine. Make attempts. Get it wrong. It's okay. It's better you get it wrong here than, when you are doing the main thing. Get it wrong now. Then tomorrow morning, take your time. Go back to this video. You understand? No matter how long you think it is, go back to it. You can put it in fast so that it can be going fast. Then you make sure you catch everything. Because, this course is heavy course, man. Honestly. Yes, the answer to this question is isotonic. I have 5 more questions and I'm going to rush it. This one, I'm not asking this question. A patient with elevated electrolyte level is likely to receive DASH solution. It's hypo now. I told you when it's high, give low. Simple. Don't be pessimistic. Be optimistic. We will. A patient with low electrolyte level is likely to receive hypertonic. You see the point? If you understood what I explained about which fluid to give, hyper, hypo, iso, you get this question. Like there are about 3 straight questions now. This one says a patient with low electrolyte level is likely to receive DASH solution. If it's low, then give high electrolyte. Simple. This patient has low electrolyte, then I'll give you high electrolyte. That's hypertonic solution. This patient has high electrolyte, then I'll give you low. That's hypotonic. All right. Somebody says so, no mass. You see mass, don't worry. I'm trying to, I have 4 questions here. Trying to exhaust it so that you don't meet any challenge. Look at this. Medications and compatible fluids can be added to a primary IV line using what? A, roller clamp. B, drip chamber. C, slide clamp. D, injection port. Quickly. If you can hurry up and answer these questions, trust me, we will leave here as soon as possible. Roller clamp, drip chamber, slide clamp, injection ports. You see? That's why we are wasting time. 1 minute has passed and only 2 people has commented. And you know I will not move. Even if you don't know the answer, pick an answer, all right? Not sure. I need something to be written, guys. So that I will not be talking to myself, you know. I know somebody is there now. You are there eating. I see you. You are eating. I can smell that food. And it's even rice and pea. With chicken. I got my eyes on you. You say I am frozen. No, I'm not frozen. No, I can see myself. I'm lagging a little. I know I'm lagging a little. Anytime I power this thing, I lag. But I have to do it because I'm putting the options for you guys. Please, the answer to that question is injection ports. Medications and compatible fluids can be added to a primary IV line using the injection what? Ports. Yes. Sorry. Injection ports. Injection ports. That's the answer. Sorry. Oh. Look at this equation. Look at this equation, guys. And look at the options here. I like this method I brought, but the only problem is that it will be lagging. The difference between macro drip and micro tubing is the dash. A, length of the tubing, size of the drop entering the drip chamber, diameter of the tubing, type of drip chamber used. A, B, C, D. Quickly, guys. Yes, you guys are so correct. The answer is size of the drop entering the drip chamber. All right. The other one, oh, Jesus, my nose is stuffing. Okay. The answer is B, guys. Size of the drop entering the drip chamber. That's the answer. Look at this question. Don't worry, we're almost done. Look at this question. Look at the options here. We have central line, we have porter cut, we have picker, we have a peripheral line. What's the answer? Central line, porter cut, PICC, peripheral line. Quickly, guys. Which type of IV line is inserted into an arm vein and threaded into a central vein? Which one? We put it in the arm, all right? Then we thread it central. I need you to think. We put it in the arm and we thread it central. Yes, you guys are so correct. The answer is PICC. What is PICC? Peripherally, arm, inserted. It is inserted in the arm, central catheter. PICC. That's the answer. That's why the question says from the arm vein threaded into the central catheter. All right. So remember that. How about this one? The same option. Okay, got it. Yes. Yes, I like that person that said not sure. That's good. I like it. You have to say something. Look at this one. A device that is surgically placed under the skin and accessed through the skin to administer IV medication intermittently is a dash. Quickly. Use the same options. Central line, porter cut, PICC, peripheral line. Yes, guys. Yes, guys. You guys are so correct. The answer is pot a cat. Somebody says it's not pot a cat. The answer is pot a cat, please. All right. Now, second to the last question. Look at this question, guys. Look at that question. I need you to take time to read it so that you understand. Choose your answers carefully. Hey, choose your answers carefully, my people. And these are the options. Let me separate it very well so that to make sure everybody looks at is able to see it properly. Okay, so that's the question. Quickly, guys. A hospitalized patient. Hospitalized patient is to receive medication through an existing saline lock. The medication technician prepares the medication, then attempts to flush the saline lock before administering the medication. However, when he presses the plunger on the flushing syringe, he feels significant resistance to the flow of saline through the lock. What should the medication technician do? A. Increase the pressure on the plunger to force the saline through the lock, clearing any blood clots. Attempt to flush the lock with heparin instead in order to dissolve any blood clots. Stop the procedure immediately to avoid forcing a blood clot into the bloodstream. Pull back the plunger in an attempt to pull any blood clots out of the lock in the syringe. Let me see what you guys choose. Start exactly. Jesus, you guys are too smart. The answer is what? C. Stop the procedure immediately to avoid forcing blood clot into the patient. Chicken, huh? Don't come and kill somebody. All right. So for this part, the last question, yes, somebody was asking me the percentage of question. Yes, the first and this part we have more questions than the others. All right, because I think I spent a lot of time on them, so we compensate by making sure there are more questions in them. Look at this question, guys. Take time to read it. I'm going to post you the option now. So that's the question. A patient is to be sent home from the hospital with a heparin lock. Which of the following instructions should be included in the patient's teaching? A. Avoid getting the injection site wet. Do not exercise while the lock is in place. Flush the lock only before and after administering medication. If redness and swelling appear at the site, remove the heparin lock. Remember, the question is, which of the following instructions should you give this patient? People are saying that you should tell the patient to flush. So you will tell your patient to flush. People don't understand this flushing thing. You tell your patient to flush. My C group of people. You really will tell your patient to flush? So what is the answer? I lied. Yes, the answer is A. Please, The answer is A. The patient should avoid getting the injection site wet because of infection. All right. Every other thing is not that important. Like do not exercise while the lock is in place. What does that? Flush the lock only before and after medication injection. No. Right. You can. The truth of the matter is that flushing of the lock, the patient can actually flush 2 to 3 times. But when he feels resistance, that's the problem. When immediately you feel resistant, please don't flush. You understand? But if you do your thing and there's no resistance, it's okay. All right. So flush. So the flushing must not be before and after administration of medication. No. All right. Yeah, so that is it. That's it for chapter 2. Chapter 3, I don't know if I want to discuss it. Should I just jump into the question, guys? Tell me yes, please. Say yes, say yes, say yes. Should I jump into the question? Just say yes, please. Say yes. Jump into it. Let me see whether 20 people will say yes. If 20 people say yes, I'll jump into it. Honestly. Let me see. Let me count it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. C. 12. 13. We can ask questions. Yes, you can. 13, 14, 15, 16, 17, 18, 19, 20. Okay. Thank you. Thank you. I was afraid that somebody would say, no, Professor, I want you to discuss it. Please. That slide, I think that slide is up to 100 and something. And honestly, I don't want to discuss it. So that means I'm not discussing it then. Chapter 17, I won't discuss chapter 17 again because we already done chapter 17. All right. So I'm going straight into it. And this one is calculations. Calculation for special populations. All right. Done discuss. Thank you. Thank you. I was looking for 20 and now I got up to 35 this thing comments. Why is this 35 people not commenting when I ask question? I don't understand it. And now because you don't want to see my face again. How many more? We have 2 chapters, but we already discussed the last chapter. So, and this particular one, I'm just giving this particular chapter is just, well, I'm just going to give you 20 questions because it's very straightforward. Just 20 questions. If you can answer me the way you just answered this thing now, you don't want, I know you don't want to see my face, you want to go. If you can answer me the way you answered me this thing, I can assure you in the next 30 minutes we should be done. That's if I give a question, everybody should answer it very fast. Like this. You have to study. You don't have to study, you just have to listen. You just have to study and follow me. Yes, 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 yes. Okay, look at the first question. Which of the following patients based on age would require extra consideration when calculating medication dosages? 18-year-old, 25-year-old, 40-year-old, 70-year-old. Quickly. If I can get very fast response, I move fast. Which of the following patients based on age would require extra consideration when calculating medication doses? 18-year-old, 25-year-old, 40-year-old, 70-year-old. Quickly. If I can get very fast response, I will move like, with the speed of light. You guys are so great. Yes, 70 years old. So the older the geriatrics, you guys are so correct. Look at this question. DASH is the process that removes a drug from the site at which it was administered into the bloodstream. DASH is the process that moves a drug from the site at which it was administered into the bloodstream. A, pharmacokinetics, absorption, biotransformation, distribution. Quickly. Just one person, you see? 1 minute has passed. If you don't know it right, not sure. Yes. You said 80, 70. Yeah, correct. All right. The older, the more focused. All right. Option, the repeat. DASH is the process that moves a drug from the site at which it was administered into the bloodstream. Pharmacokinetics, absorption, biotransformation, distribution. Where are all those people? So guys, pharmacokinetics, right, is just movement of medications. But when you are talking about entering the bloodstream, anything entering the bloodstream is absorption. If you are doing like in AP, if you are talking about digestion, if you eat your food now, you eat your food from your mouth, it passes the esophagus, goes to the intestine, stomach, goes to the small intestine. At the small intestine, what happens? The absorption. What is absorption? Moving from small intestine into the bloodstream. If it doesn't enter the bloodstream, we say it's not absorbed. So answer, absorption. Answer, absorption. Answer, absorption. I'm not talking about it again, all right? The same, using the same option. I need you guys, if you can answer quickly, we move quickly. Oh, I just heard move and thought kinetics. No. Don't get confused. Where is he moving into? Kinetics is just talking about how it circulates, all right? So, look at this question. Using the same option. Use the same option. The movement of drugs from the bloodstream into the tissues, from the bloodstream into the tissues, is called what? 70 or 80, yes. This person is far away from where we are. Quickly, guys. Movement of drugs from the bloodstream into the body tissues is called what? Yes, the answer is distribution. You guys are so correct. The answer is distribution. Perfect. Thank God nobody. So you know the difference between distribution and absorption. We will get the other ones, all right? So, but just stick these ones into your head now, all right? Distribution. When it's now moving into tissues. But when it moved into the blood, it is what? Absorption. Look at this one, guys. The process of chemically changing a drug is called metabolism or biotransformation. Alteration in which organ would greatly affect this process? We have the liver, kidney, stomach, intestine. Liver, kidney, stomach, intestine. They are just asking you, where does metabolism take place? That's what they're just asking you. Or where does biotransformation take place? We have the liver, we have kidney, we have stomach, we have intestine. Which one? Quickly, guys. Where is everybody now? Come on, guys. Where are you guys? Yes, the answer is liver. Okay. Look at this question. Patients with poor circulation are likely to experience alterations in. Look at the options. Look at the options there. Patients with poor circulation are likely to experience alterations in metabolism and absorption, distribution and metabolism, absorption and distribution, absorption and elimination. Metabolism and absorption, distribution and absorption and metabolism, absorption and distribution, absorption and elimination. If you have poor circulation, the patient has poor circulation, what is the most likely? Quickly, guys, quickly. So this patient has a poor circulation. Good. Because he has a poor circulation, the answer is C, guys. That's why I posted it. The answer is C. Because he has a poor circulation, the patient will have a problem with what? Absorption and distribution. Metabolism is not circulation, guys. So anyone that has metabolism is automatically out. Elimination is not circulation. So anyone that has elimination is out. So it has to be what? Absorption and what? Distribution. I need you to take note of this thing now. Take a mental note of it, please. Because it will be bad that we spend all this time and you see the similar question and you get it wrong. It will be terrible. I'll be very angry. Look at this question, guys. Take time to read that question. Look at the options. Physicians may be inclined to order larger than normal IM drug doses for patients experiencing which of the following words? If a patient has a problem with words, we now the clinicians start thinking of, oh, maybe I should just give this person higher quantity of this medication. Come on, guys. Circulation impairments, kidney impairments, liver impairments, mental impairments. So how you do this thing is ask yourself, take all of them one after the other. All right. For example, the B that says kidney impairment, ask yourself, oh, if somebody has kidney problem, should I give that person more than normal amount of drug? No, makes no sense. So that's out. Oh, if somebody has liver problem, should I give the person more than normal amount of medication? You want to kill the person. So that is out. Kidney is out. Liver is out. Mental impairments has no say here. Self. So that one is also out. So leaving us with A, circulation impairment. So if you don't have your thing is not moving a lot, right? Then I'll give you more so that at least, some will be able to move, So that's circulation impairments. So that's how you eliminate to get that answer. Yes, you will say circulation. Circulation is correct. All right. The circulation impairments is correct. Look at this question, guys. And look at the options. Quickly, guys. The elderly tend to have lower muscle mass. This often causes A or and dash. Increased creatinine clearance. Decreased creatinine clearance. Increased creatinine absorption. Decreased creatinine absorption. What's the answer? Somebody say faster absorption. There's no faster absorption there. Are you talking about increased creatinine absorption? You have to just pick A, B, C, D. Quickly, guys. Quickly, guys. The answer is B. When you're talking about creatinine, you're not talking about absorption, you're talking about clearance. Creatinine is as a result of muscle. You understand? Muscle breakdown. That's what creates creatinine in the body. So it has to be cleared. And it's cleared 100%, 99.9%. All right? If it's not cleared, and we see some certain amount of creatinine in the blood, the person has kidney problem. Now, elderly patients, their muscle mass is low. So automatically, their creatinine will be low. That's what they're talking about. Decreased creatinine clearance. Makes sense? It's decreased creatinine clearance. The answer is B, guys. Please don't fail it. I just gave you an explanation for it. You can't afford to fail that question. It's a giveaway. Honestly. It's a giveaway. Look at this. When administered to patients having less than the ideal body weight, water-soluble medication doses should be calculated based on what? Let me give you the options. I'll post it. Look at the options. When administered to patients having less than ideal body weight, less, water-soluble medication dosage should be calculated based on what? Somebody said weight. There are a lot of things that has weight in the option. I think you should just pick A, B, C, D. Here is all my people now. Are you? Don't be tired. Wake up, 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 wake up. Don't be tired. Go and bring water. Put your leg inside it. Let's finish up this thing. All right. This one has just 10 more questions and we are done with it. And we jump to the last chapter. We'll discuss 20 questions and we are out of it because, you know, there's a possibility you'll be answering up to 80 questions tomorrow, or for people that are in my class anyway. I don't know about the other lectures. Are you guys there? Okay. Yes, the answer is what? Actual body weight. Please. Even if that person, the body weight is less than the ideal body weight. All right. As far as it's water-soluble medication, please give the person actual body weight. Extremely important. You can't forget. The answer is C. The answer is C. Look at this question, guys. What is polypharmacy? What is polypharmacy? Oh, Lord. This thing is so large. Jesus. What's polypharmacy? It's A, B, C, and D. Just pick one. Patients using more than one pharmacy to get prescription filled. Patients taking many medications at the same time. State and local pharmacy chains that are specialized in pediatric prescription. State and local pharmacy chains that specialize in pediatric, whatever. Yes, you guys are so correct. The answer is B. All right. The answer is B. Look at this question. Elderly patients with clothing disorder should avoid which of the following medications? Narcotics, antipsychotics, aspirin, steroids. Elderly patients with clothing disorder should avoid which of the following medications? Narcotics, antipsychotics, aspirin, steroids. Quickly. Elderly patients with clothing disorder should avoid which of the following medications? Narcotics, antipsychotics, aspirin, steroids. Yes, for that question, B is correct. All right. For that question, B is correct. Yes, the answer is aspirin, not steroid. The answer is actually aspirin. All right. Anything clothing disorder. Why will you want to give aspirin to that patient? What is B? B, like the other question that we discussed now, the one that was talking about polypharmacy. That's when patient is taking many medications at the same time. That's polypharmacy. All right. Then we already discussed elderly patients with clothing disorders. That's aspirin. Then I just gave you a new question. The study of what happens to drugs in the body is what? We have medical kinetics, we have pharmacology, we have pharmacy, we have pharmacokinetics. Quickly. The study of what happens to drugs in the body. Pharmacokinetics. We have A, medical kinetics, B, pharmacology, C, pharmacy, then pharmacokinetics. Quickly. This part is very straightforward. Quickly, guys, quickly. I'm getting only 3 answers. What's happening? The answer is pharmacokinetics. Yes, you guys are so correct. Look at this question. Drugs can be dashed through sweat, feces, or any other body secretions. A, absorbed. B, eliminated. C, distributed. D, changed. Yes, the answer is pharmacokinetics. You're correct. Drugs can be dashed through sweat, feces, or other body secretions. A, absorbed. B, eliminated. C, distributed. D, changed. Quickly, guys, quickly. Yes, the answer is eliminated. Yes, pharmacokinetics, yes, that's answer for that other question. This answer is eliminated. You are very correct. Look at this question. If a patient has liver disease, the medication dose may have to be dashed because of alterations in metabolism. If a patient has liver disease, the medication dose may have to be dashed because of alterations in metabolism. A, decreased. B, increased by half. C, left unchanged. D, increased twofolds. Quickly. Yes, eliminated is correct in that question. You're correct. If a patient has liver disease, the medication dose may have to be dashed because of alterations in metabolism. A, decreased. Increased by half. Left unchanged. Increased twofold. Yes, you guys are so correct. The answer is decreased. All right. You guys are so correct. Look at this question. Yes, the answer is decreased. Look at this question. And look at the options. I just posted the options. Which of the following is not a recommendation for working with geriatric patients? Encourage them to participate in planning their schedule. Ask if they need bottle caps that are not childproof. Instruct them to take their medication using color of tablets. Make a chart with the names of medication names and descriptions. Which of the following is not a recommendation for working with geriatric patients? Not. Choose A, B, C, or D. Quickly. For people that are working in a geriatric environment, what is the answer? Quickly, guys. The answer is C. The answer is C. Instruct them to take their medication using color of tablets. It's not a recommendation. Please, the answer is C, not D. The answer is C. Color. The answer is C. I'm singing it now. Color. That's why you need to attempt these questions so that if you get it wrong, you'll be able to remember it. Because if you get it wrong, you've read the question. So when you see something similar, you remember it. All right? Look at this question, guys, quickly. Look at, oh shit. Look at the question. Look at the options here. Although the physician prescribes prescription medication dosages, if you are going to measure and administer the medication, you must do what? A, give the medication without questioning the order. Hold the medication if it is safe dose. Give the medication even if it's outside the standard recommended dose. Check that the dose is the standard recommended dose. Answer. Quickly, guys, quickly. I need everybody to be typing. Perfect. This is what I want now. If you people can give me answers like this, we'll be very fast. Yes, you guys are so correct. You guys are so correct. The answer is D. Check that the dose is standard recommended dose. That's the answer. Look at this. BSA is stated in dash. Yes. Decrease. Check that the dose, yes. BSA is stated in dash. A, milliliters per kilogram. B, square meters. C, square pounds. D, kilograms per pounds. What's the answer? BSA is stated in dash. A, milliliters per kilogram. B, square meters. C, square pounds. D, kilograms per pound. What's the answer, guys? Quickly. Quickly, what's the answer? So BSA is in square meters, all right? Yeah, nice one that you said you are not sure. I like it when it's square meters. So the last question, guys. There are some other questions, but no need. The last question. Look at this question. Which of the following is a factor in causing an adverse drug reaction? We have young age, we have polypharmacy, we have taking only one medicine, we have living with family. Which of the following is a factor in causing an adverse drug reaction? Young age, polypharmacy, taking only medicine, living with family. Quickly. Polypharmacy. Very correct. I'm jumping to the last part now. And this last part, I'm going to give you only 15 questions and you go and sleep. Just 15 questions. So everybody should stick with me, all right? I don't want anybody leaving. Let's just do 15 questions. I have almost 30 questions here, but no. I'm going to give 15 questions. You understand? So this part and the first and the second part, we have the bulk of the exams, all right? First and the second part, we have the bulk. For the person that was asking me percentage, first and second one, we have the bulk. Third one, we also try, like this one. But this one is just take a few questions from it. It's more calculation here, but, we don't have much time now to do that. So let me ask you superficial questions on it. So we are in the last part now, guys. Are you ready? All right, let's test the microphone quickly, guys. Somebody is very ready. It's activated. Yeah, so if not that these things are things you really need in the health clinic, I would have just, forgotten about this last chapter, but you really need it. This one is even much more important than others. So look at the options here, guys. To administer critical care medications, an electronic infusion pump dosage needs to be calculated in watts. Now we are slow again. we are back to status quo. Now this the calculations in this thing is too long. I can't give you these calculations. It's too long. Okay. What was the answer? Hold on, I'm still checking the ones I should give you and the ones I shouldn't. This thing is so important. Okay, yeah, the answer is B, guys. ml per h. That's the answer, guys. The answer is B. Please, the answer is B. Very important that you know these things. Trying to give you some of these questions that does not require calculations. But you will see me some calculations along the way. Any problem is that this calculation now will take my time, so and your time. And I really need you guys to go and rest. So look at this question. So I need you guys to try. Let's go faster. Orders based on body weight are often expressed as dash. A flow rate per minute, flow rate per weight per time, the amount of medication per weight in kilograms per unit of time, C, drugs per unit per pound, D, the amount of mediation per weight in pounds per unit of time. Quickly, guys. Orders based on dry weight are often expressed as what? Quickly, guys. Yes, the answer is B. The amount of medication per weight. Per weight in what? In kg per unit of time. All right? You can't forget that though. Now, this is a giveaway question. I'll call the options for you, so you just listen. This is a giveaway question. The adjustment of a medication administered rate based on its effect on a patient's heart rate is called dash. That adjustment is called dash. A, titration. B, infusion. C, alligation. Ah, Jesus Christ. I will not die. Alligation. D, QSAD. What's the answer? Adjustment of a medication administration rate based on its effects on body's heart rate is called titration, infusion, alligation. Quickly, guys. Only 5 people. Come on, we're up to 40 here now. Everybody should type. If you feel it's simple, still type it, please. I'm interested in seeing that people are still awake. Which of the following are frequently titrated in response to the... Yes, the answer is titration, guys. It's correct. You are so right. Which of the following are frequently titrated in response to the patient's vital signs to maintain the blood pressure within the normal range? I'll give you options. Antiarrhythmic medication, analgesics, sedatives, and vasoactive medications. What was the answer? Which of the following are frequently titrated in response to the patient's vital signs to maintain the blood pressure within the normal range? Yes, I see you guys are really doing well. Honestly, you don't have a choice but to get 100 in your exam. You don't really have a choice. You see how I'm avoiding calculation questions? Try to avoid it for your sake. What happened? I think you guys need glucose. So what's happening? Why are you telling me the answer is A? He said, I did not say there is no calculation, no. That's not what I said, though. I said I'm just avoiding some calculations because they are lengthy. I don't want something that will take your time. I didn't say there's no calculation, no. Please, oh. So why are you people choosing A in that question? Anti-arrhythmic medication, like anti-arrhythmic. Anything arrhythmic is talking about electricity of the heart, right? But here they are telling you what? Vital signs, blood pressure. Blood pressure is talking about fluid. So they are vasoactive fluid. Where do they move? Vessel. Vasoactive medications, not anti-arrhythmic medications. Anti-arrhythmic medication deals with the electricity of the heart. That's arrhythmia. You understand? Arrhythmic medications. But when you're talking about vessel, what is moving in the vessel? Blood. How is it moving? The pace. That's what? Pressure. All right? So the answer is vasoactive medication. Guys, I thought it's a giveaway, but it's not. It became a question that a lot of people failed. So look at this question. Look at this question. Let me put the options. Look at the options. If you know the total amount of medication, the total volume of medication, and the volume of the solution the patient has received, you can determine the dash. Yes, it's vaso. If you know the total amount of medication, the volume of the solution the patient has received, you can determine what? A water-based, weight-based amount to deliver, dosage on hand, dosage ordered, amount of medication received. Quickly, guys. The answer is amount of medication received, D. You guys are so correct. So I just isolated some list of medication to this. I just want to give 10 questions here from this particular chapter. Because every other thing is calculation. So medication to receive the children. Okay, look at this. Yes, for that question, the answer is D, the amount of medication received, guys. Is the D, not C. Somebody says C. Please take notes. The answer is D. Dosage ordered, you get it from prescription now. All right. The dosage on hand, you get it from the pack. You understand? So you don't need to do calculation for all those ones. Yeah. Look at this, guys. The goal of administering medication in critical care is to administer the. What's the goal of administration in critical care? Look at the option, guys. But I like the fact that you are trying, all right? So don't. Sorry. I don't know what I'm reacting to, man. Maybe I'm reacting to this, my laptop not working very well. The goal of administration, thank you. The goal of administering medications in critical care is to administer the A, largest amount of medication to achieve the desired effect, the largest flow rate to achieve the desired effect, least amount of medication to achieve the desired effect, largest volume of medication to achieve the desired effect. Quickly, guys, give me A, B, C, D. Quickly, quickly, quickly. So the answer to that question is what? Is C. The goal of administering medication in critical care is to administer the least amount of medication to achieve the desired effect. All right? Not to give the most amount of medication. No, the least to achieve the desired effect. The answer is what? C. The answer is C. Look at this. So I need you to read it quickly and understand it and tell me the answer. These are the options. Mrs. Hedge's weight has fluctuated by as much as 8 pounds over the past 4 days. The prescriber is ordering an antibiotic that is ordered in mg per kg. To calculate the proper dose, the prescriber would need to use what? Her weight from yesterday, her BSA, her weight this morning, her dry weight. Which one is the answer? Quickly, guys. Quickly, guys. So the answer, a lot of people are choosing C. A lot of people are choosing C. What's C again? Her weight this morning. No, it can't be her weight this morning. The weight is fluctuating. So just use the dry weight. Dry weight is the actual weight of the patient without fluid. All right? Without all those excess fluid. So you use what? Her dry weight. Guys, please, the answer is D. Her dry weight. D. Her dry weight. Please. Please. The answer is D. Her dry weight. The original response is 60 prescribed parameters at the minimal dose. Okay, so I'll give you three or four more questions, but this ones will involve a little calculation. All right. Look at this. Trying to avoid the more serious calculations. So let me give you the unserious calculations. So look at this, guys. Yeah, look at this, guys. Give me the answer quickly, please. Let's move. Like there are some calculations that will take you time, so I'm avoiding them. That's what I'm trying to do now. That's what I'm trying to select. This is my phone. I sent to you. Quickly. Let me see. What's everybody choosing? A. 3 months ago, yeah. Yes, guys. No, I'm not sleeping. I'm here. I'm just trying to select the questions and forward here. It's just a little more process for me. Yes, guys, the answer is 8 ml per H. I believe this type of calculation is easy. Yes, I believe everybody will understand this calculation. You understand? That's what we've been doing all day. I'm trying not to give you the... This question will be difficult for you people. Trying to... Just give me a moment, please. I'm trying to select... How many questions are I giving you guys here for this last chapter? Somebody keeping track? No, you're not keeping track. Okay. So look at this question. The hourly dose for heparin solution is calculated as what? Drops per minute, ml per hour, ml per minute, units per hour. Which one? The hourly dose for heparin solution is calculated as drops per minute, ml per hour, ml per minute, units per hour. Units per hour. Okay. Yeah. Okay. I'll give you Just 2 more questions. Trying to look for something that will not take your time. So look at that question. You see the options. Okay, DMFN would not include fluids used to flush a Foley catheter. Okay, oral parenteral fluids, IV flush fluids, fluids used for Foley catheter, medication and diluents. Everyone. Let me give you the final question. Hurry up. I want to give you the final question. I'm seeing only 4 people. Why? We're up to 50 people here. Come on, guys. We're already done. Why are you disappointing my vibe? We're already done. Yes, the answer is C for that question. Yes, C. C is correct. C is correct. That's fluids used to flush a Foley catheter. So look at this question. It will be your final question. I'm trying to avoid anything calculation. Some people say, don't. The calculation I have here, if I give you this calculation, you will solve it. And you will hate me. I don't want you to hate me. I don't need some hits. When performing dosage calculation for a high alert medication, you should A, show the syringe to another healthcare professional to verify the dosage, show another healthcare professional the vial of medication to validate the dosage, administer the medication as soon as you have calculated the dose, have another healthcare professional calculate the dosage independently. What's the answer? Quickly, guys. Come on, guys. Everybody. We are 30 people here, so I'm still waiting for some people. The goal of administration and education. Okay. Yeah, for that question, let me see. What question did I even ask you? When performing? Let me see the question I asked you. When performing dosage calculation for high alert medications, right? Yes. You should what? The answer is D. What? You said A? Ha. You should have another healthcare professional calculate the dosage independently. All right. You should have another healthcare professional to what? To verify the dose when you are calculating it so that you don't make a mistake because it's a high alert. You guys are saying A. Let me see what is A. Show the syringe to another to verify the dosage. So if I take syringe and show another healthcare, think about it. So, oh, look at the dosage. Oh, it's 0.5 mils. Okay. The person you are showing doesn't know why you are showing him anything. But if I tell the person, please, can you help me do this calculation? Let me see if you get exactly what I got. That's when you are making sure. So the answer is not A. The answer is what? D. You have another healthcare professional calculate, not to look at the syringe. Has no business looking at the syringe. Are we good? Okay, so guys, you have any question for me? If you don't have any question for me, it's 12:22. You need to go sleep. For me, I have a long day tomorrow. My first class is 10 o'clock. So I have to leave my house by past 7 because I'm coming from Staten Island. Meaning that I will definitely sleep probably in the next 2 hours or 1 hour, maybe around 2 o'clock. Then, because I need to set your questions now. So for people that are in my class anyway, in our school. Yeah, so try to join the channel, try to be a member, because especially if you are not in my class for next semester, try to be a member because there are some things I'll be dropping, some exam tips, especially for the school, and and it's only for membership. Try to be a member, subscribe. Okay, thank you guys. You guys are the best. I really enjoy talking to you. All right, take care of yourself. See you when I see you. And I wish you success in your exams, all right? Yeah, hit the like button, yes. That one that did like this. That button that is like this, yes, hit the button. Yeah, thank you so much. Yes, try to rewatch it, all right? What you need to do, you can go sleep now. When you wake up in the morning, do whatever you are doing, but before your exam, try to watch this video again. Don't let it be just this once. Let it just be your only revision. This is a recap. That's why we do it very late. You understand? This is recap, all right? This is recap, final exam preparation. So you need to, do it, focus on it. The more questions you do, the better. Look at those questions that we've discussed very, very, very well, because you definitely have to get something similar to them so that you don't fail one question, all right? Okay. So don't relax now. Everybody should make sure that they watch it. When you watch it again later, type ready. Type ready at the comment section. All right. Take care of yourself. Thanks once again, guys. Have a nice day. I'm going to end the stream now. Still trying to sort out these questions. Yeah, administer. Others based on body multi-medication per weight. Titration. Yes, good night. Take care. Yes, take care of yourself, all right? You're welcome. You're welcome. Yeah, you should. You should. You should. All right. I will post it for you. Or you just. I'll post you the link. All right. Okay. Take care of yourself. Eh. I'll end the stream now. Take care of yourself.